Good morning, everyone. My name is Joe Batia, and I'm President and CEO of ANSI. On behalf of our event partners, Underwriters Laboratories, Inc., and the U.S. Consumer Product Safety Commission, I'm very pleased to welcome you to today's workshop. For more than a century, ANSI has been bringing diverse stakeholders together to address complex issues that cross multiple industries. Our role as the coordinator of the U.S. Standards and Conformity Assessment System has provided us with unique perspectives into the business case of standard setting. In fact, much has been written about the economic impact of the standards, but there's much less data about how to empirically measure the other side of the standardization coin, those aspects that help our families, friends, neighbors, and colleagues live healthier, safer, and better lives. Today's workshop launches an important exploration on how to best quantify the health and safety impacts of voluntary consensus standards. Having the tools to measure impact will help us clearly see the effects of our efforts so that we can reinforce what is working and change what is not. The idea for today's event originated during a conversation between the representatives of CPSC and UL. Both organizations were devoting time and resources to evaluate how and why the health and safety aspects of standardization are important. They knew that the SDOs were considering the topic and that other federal agencies besides CPSC were also interested in the results. To broaden the window of participation, ANSI agreed to hold a forum that would bring all the interested stakeholders to this virtual table. Representatives from SDOs, federal agencies, consumers, and manufacturers will share their perspectives during this morning's presentations and this afternoon's panel discussion. As always, the open dialogue will be enhanced by your active information sharing and participation. So please use all the tools that Zoom provides for a productive exchange. The work we do together will lead to more responsive standards development, provide objective evidence to support the public-private partnership that drives the adoption and use of voluntary standards, and most importantly, benefit the consumers. We look forward to your contributions today and your follow-up on collaboration. Now, it's my great pleasure to introduce our esteemed keynote speaker, someone who's intimately familiar with the intricacies of the research and the vital importance of standardization. In November 2017, Dr. Laurie Lacasio joined the University of Maryland as its Vice President for Research. In this role, she was responsible for the university's vibrant research and innovation enterprise at the College Park and Baltimore campuses, which garner a combined $1.1 billion in external research funding each year. Now that's quite impressive. She has served as a professor in Maryland's Fischel Department of Bioengineering and secondary professor in the Department of Pharmacology at the University of Maryland School of Medicine. On July 16th, Dr. Lacasio was nominated by President Biden to serve as the Director of National Institute of Standards and Technology, NIST. Dr. Lacasio previously spent 3 decades at NIST, most recently as acting principal deputy director and associate director responsible for leading the internal scientific research and laboratory programs across 2 campuses in Gaithersburg, Maryland, and in Boulder, Colorado. She holds a Bachelor of Science in Chemistry from James Madison University, a Master of Science in Bioengineering from University of Utah, and a PhD in Toxicology from University of Maryland, Baltimore. It's indeed my honor and great pleasure to congratulate Dr. Lacasio on her nomination and to turn the screen over to her. Laurie, please take over. Thank you very much for listening.
Good morning. First, I want to thank ANSI, the Underwriters Laboratories, and the U.S. Consumer Product Safety Commission for putting together a meeting on this important topic of voluntary consensus standards related to human health and safety in celebration of World Standards Week. In particular, I'd like to thank Fran Schroeder, Mary Saunders, and Jim McCabe for the invitation to speak with you today. And of course, I would like to thank ANSI President and CEO Joe Bhatia for the kind introduction. I look forward to hearing the presentations today regarding the metrics to measure the impact of standards on our health and safety, and the panel discussion with leaders representing government, SDOs, industry, and consumers to hear their perspectives on this issue. I've had the opportunity to work with many of you in my previous roles at NIST, and I welcome the opportunity to work with you once again if I am confirmed as the next NIST director. If confirmed by the Senate, I will be following in the footsteps of some wonderful people who I admire greatly, Willie May, Pat Gallagher, Arthi Prabhakar, Bill Jeffrey, and Rach Samerjian. Many of them are well known within the ANSI community. So I'll speak from my personal perspective today as a consumer, but then from my experience at NIST in the voluntary standards arena. Every day, we benefit from standards that have been developed through voluntary consensus processes without ever hearing the word standard. Our small electronics and large appliances, the features in our cars that make driving less of a chore, our children's toys, and our grandparents' medical equipment are all made better because of consensus standards. Yet the young mother, the teen with the cell phone, the person in the nursing home, none of them realized that there were sometimes hundreds of world-renowned experts behind the development of that new recommendation or that new legal requirement that makes a valued product or feature reliable or safe or interoperable. The standards developed by voluntary consensus standards organizations are responsive to the events in our lives every day. As an emerging virus became the COVID-19 global pandemic, the Association of Home Appliance Manufacturers developed much needed methods to clean face masks. And ISO quickly drafted through online meetings a new standard to support the rapid development of new lung ventilators. ASTM International convened experts to draft its standards for face coverings. And just as importantly, you have stepped up to make these standards accessible to those who need them the most. Many methods and standards developed in these and other groups have guided us through the pandemic as safely as possible. A maturing technology, artificial intelligence, is everywhere in our everyday lives. It is a dominant technology solution and the topic of conversation across the business landscape. And standards organizations like the Association of the Advancement of Medical Instrumentation are keeping up with this changing world by developing guidance documents and standards for artificial intelligence and machine learning so that they can improve medical technology while keeping it safe and secure. Similarly, UL is developing standards for the evaluation of autonomous products, and the US contributions to and efforts in the work of ISO and IEC are helping to develop horizontal standards for AI. The intense fires and storms and floods of 2021 have painfully demonstrated the tremendous health and safety impacts of climate change. And EPA is working to develop standards and guidance to help us address this enormous challenge. And a no less impactful challenge, that the one of safe sleeping for newborns and infants, was recently addressed by guidance for the Consumer Product Safety Commission, while IEEE, UL, and IEC are developing standards for the safety of batteries that power all of our home electronics while we work remotely. Now, my professional roles have included scientist and engineer with a background in biomedical engineering and toxicology. At NIST, I had the opportunity to lead some of the earliest programs in bioscience and help to permanently place that area of research and related standards in the NIST portfolio. While at NIST, I also participated in and led several standards committees and working groups related to public health and safety. In the aftermath of the anthrax attacks in Washington in the early 2000s, I was invited to lead a group of government agencies public health, and forensic science stakeholders to develop standards through ASTM for collecting suspected biological agents. And I also had the opportunity to be US chair and then international convener of the ISO TC 229 Nanotechnologies Working Group on the health, safety, and environmental impacts of nanotechnologies, staffed, by the way, by Heather Benka, who is an incredible talent at ANSI. These opportunities gave me an inside look at the intricate development process behind both national and international standards. All of us here are aware that the standards process in the United States is not centralized, but consensus-based, market-driven, led by the private sector, and flexible and adaptive. And it's a living example of the strength of public-private partnerships, where industry, government, and academic experts and users all come to the table equally to share knowledge and build out the best guidance based on the most advanced understanding of the applicable science and the field's technical capabilities and challenges. Standards developed in this way by a sector's practitioners are extremely effective in that they can be quickly adopted by those same practitioners. My direct experience with standards bodies has given me a great deal of insight into international standards engagement and strategy, and the potential impact of all standards on our industries and on our economy. When standards are adopted, they represent broad agreement on solutions. Broad adoption of a standard across an industry can translate into billions and even trillions of dollars in trade across boundaries. And so it is important for us to be mindful of the significant negative impact when standards become technical barriers to trade. Standards can accelerate innovation because inventors and entrepreneurs can more quickly enter a manufacturing ecosystem where the performance and safety expectations behind the product are clear because they have been defined by standards. As economic competition around the globe heats up, more and more people are becoming more deeply aware of the foundational role of standards and the potential impact on industries, on communities, and on lives. So as we contend now with market and supply chain disruptions, it's important to stay focused on the goal of developing the best standards possible to support a thriving and robust economy. Our decentralized approach, our invitation to participation by all experts representing both the public and private sectors is relatively unique compared with the top-down approach used by many other countries. But this approach has also directly contributed to America's technological leadership during the past century. In the group of international volunteers that I had the pleasure to convene, it was clear that some countries, even some you might not expect, wanted to drive health and safety standards toward their own national policies and politics. But in that forum, with representation from across the globe, that approach did not win out. Through sound debate, despite the differing approaches to policy among those of us attending from around the world, sound science and technical merit won out. Now, I know you're here today because you're a believer in the power of standards to propel our society forward, address its greatest challenges, and protect us from harm. I know I don't have to convince anyone here of the importance of standards for preserving our health and safety. If you lead or participate in standards activities, you know that it's our responsibility to make sure that the best scientific and technical experts that the US has to offer, which are often the best in the world, are at the table, and that perspectives from government, businesses, large and small, as well as academic researchers, are heard. The international partnerships and technical and cultural understanding formed in the development of voluntary consensus standards helps to ensure the success of those very standards. In what may seem now an especially chaotic world with new and ever bigger challenges and threats to our health and safety, your involvement in the standards development process brings order and asserts direction where and when it is needed most. Thank you for your dedication to this vital work. And along with you, I look forward to watching the rest of today's program. Thank you.
Thank you for joining us this morning. The purpose of this meeting is to start a discussion on the impact of voluntary standards. The meeting has been divided into 3 parts. First, we have 5 short prepared presentations. Next, these presentations will feed into a panel discussion. Finally, participants will answer questions from the audience. As said, please enter your questions that you have into the chat at any time. Some questions may be answered during the first 2 parts of the meeting. Others may be answered in the 3rd part. Hopefully today's meeting interests you in continuing this discussion in the future. So our presenters this morning are Casey Granada is a Standards Technical Panel Chair, Project Manager at Underwriters Laboratories, where he oversees various technical panels in energy and power technology industry, primarily focused on industrial control and power distribution. Chris Dawkins is an economist at the National Center for Environmental Economics at the US EPA, where he has focused on human health risks, the frontier between human health and risk assessment and economic analysis, and the use of stated preference methods for valuing human health and the environment. Adi Iyer is Manager of Government Relations at CSA Group. His background includes management positions in energy, healthcare, and government sectors, where he had a range of responsibilities such as corporate affairs, strategic communications, and issues management. Ray Peng works at the US FDA and the Standards Management Staff, now Standards and Conformity Assessment Program. He manages standards activities in various medical device areas. And joining him in his presentation is Amanda Benedict, Vice President of Standards at the Association for the Advancement of Medical Instrumentation. She oversees the strategic and operational functions of AMI's expansive and dynamic standards program and portfolio. And finally, Tim Fisher is the Director of Standards and Technical Services at the American Society of Safety Professionals. He provides direction in the overall administration and operation of technical aspects of ASSP-related standards, programs, and publications. Now, we'll begin with Casey talking about data.
Thank you, Scott. Welcome, everyone. This morning, I'll be focusing my presentation on the impact of voluntary consensus standards, focusing on UL's data experience. Next slide, please. UL standards at a glance. So here at Underwriters Laboratories, we have over 400 standards technical panels associated with UL standards. We have over 120 years experience in standards development. We have 86 dedicated standards professionals. We're represented over 1,600 standards that we have published, 30 plus countries represented on UL's STPs and committees, and we have over 4,000 volunteers actively participating in UL's standard development. Next slide, please. In March of 2021, UL Standards launched an initiative that was tasked to identify effective ways to measure the impact of UL and ULC standards and other published content focused on prevention of injuries and deaths. During 2021, the initiative focused on 3 specific standards in our case study. ANSI CAN UL 325, standard for door drapery, gate, lever, and window operated systems. ANSI UL 859, standard for household electrical personal grooming appliances. And ANSI CAN UL 2272, standard for electrical systems for personal e-mobility devices, also known as hoverboards. UL Standards launched a complete case study approach utilizing data avenues from the following sources: US Consumer Product Safety Commission's Clearinghouse, and National Electronic Injury Surveillance System, NICE. When UL Standards launched this case study approach, our main goal was that we want to know how our work is having an impact on public safety, and is there a way to measure impact effectively? During our case study, we found some limitations with the available outcome data, which leads me to my next slide. 3 limitations of available outcome data: limited coverage on adverse incidents, limited comprehensiveness of completeness of injury data, data on consumer product incidents impacting health and safety that are available in the United States through U.S. Consumer Product Safety Commission and National Electronic Injury Surveillance System, NICE. NICE is nationally represented probability sample of hospital emergency department visits associated with consumer product injury from 101 hospitals here in the United States. This data is largely complete, but the information pulling from NICE only covers ER visits. It is not able to cover immediate care for injuries arising from consumer product incidents, including primary care physicians, urgent care facilities, independent medical clinics, as well as hospitalizations unless the patient starts in the ER before being admitted. It's important to note that minor injuries are not captured in NICE. The CPSC National Injury Information Clearinghouse also includes death certificates and medical examiner reports involving consumer products provided by CPSC. Second, limited usefulness of incident counts. Raw counts can often be deceiving. Counts of incidents without understanding the number of products in the marketplace makes reliance on changes of these counts questionable at best for understanding the safety and health impacts of a voluntary product safety standards. Incident rates as number of incidents per number of products in the market is far superior measure for determining the risk of injury from a consumer product. As a hypothetical example, I'd like to share to demonstrate the limited usefulness of incident counts and changes in incident counts. Let's say product X experienced a doubling in the number of incidents in a single year. It may appear that product X is offering up a greater risk. However, let's say product X has a great sales year and the number of units in product X in the market has quadrupled. Then the incident rate actually dropped by 50%, indicating a reduction in the risk injury. From a raw count, we would never see the incident rate. For 3, which is weakness in interfering effects, we're unable to demonstrate the cause and effect. With no data to illuminate the process by which a voluntary standard affects the occurrence of injuries in a consumer product, it often becomes difficult to make a credible conclusion in the cause and effect relationship between the publication of the standard and any reduction of injuries from affected products that may subsequently occur. During our case study approach, we identified 3 major limitations for the purposes of measuring impact that made it more difficult to make a confident assessment of the impact of these 3 standards. Next, I would like to discuss how we overcame these limitations during our case study and what further information could also be helpful if it was readily available. Next slide, please. Limited coverage of adverse incidents. So use all available incident data, including non-injury incidents as reported through Clearinghouse. So expanding to more adverse available data. We are in search of more adverse data that could be readily available from additional sources. NICE has a purpose, but it's not broad enough to provide the data that we need. There is a limitation because we are trying to use the NICE system for different purposes. Number 2, limited usefulness of incident counts. Include proportion of incident statistics. Seek industry participation in the future to get market data on the number of products sold. Without us really knowing how many products are out there, the raw data is informative and often can be misleading. It's difficult to interpret changes in raw numbers with that denominator showing the number of products in the market. And 3, weaknesses in interfering effect. Include additional formative assessment measures designed to shed light on the process by which standards eventually affect and design the construction of products on the market. Currently, we have no data that catches the process by which a revision of the standard affects performance of products on the market. UL Standards will be continuing this case study into 2022, and we will be focused on overcoming these data limitations. This is a multi-year journey for us to overcome and define more efficient ways to measure the impact of our published content. During the panel discussion this afternoon, please feel free to add any additional experiences with overcoming limitations. Thank you for your time today.
Thank you, Casey. Out of curiosity, what data would you like to use but you don't have access to?
Yeah, that's a great question, Scott. We would love to know the number of products on the market so that we can measure based on incidents that occur rather than the raw counts of data. We would like to get involved with industry in various ways to be able to readily get a hold of this kind of data.
And what about data that you don't know how to gather?
If we don't know how to gather it, it's really hard to measure the actual impact of the actual data. So for example, if we want to look at the incident counts, we would love to get involved with different associations that track that kind of data. That data, from what we found from our case study approach, is not readily available for us to grab a hold of the number of products that are being on the market. So it makes our case study approach, and as we're compiling that data, a lot more difficult for us.
All right, thank you. Thank you very much for your time today. Any last questions from the audience? If we have no more questions here, we will move on to Chris Dawkins, who will be talking about the economic analysis side to this.
Very good.
Chris.
Thank you, Scott. Yeah, I'm Chris Dawkins. I'm with the U.S. Environmental Protection Agency, the National Center for Environmental Economics, there at the agency. And our office advises, does research, performs economic analysis for rules, regulations, policies of the EPA. One thing I can appreciate very much, Casey, is the limitations of data for estimating the changes in health effects, health risks. That is a constant challenge in the environmental context, of course. With that said, next slide, please, and I'll give you some background. What I'd like to talk with you about today is approaches for valuing health impacts, or the approaches that we use at the Environmental Protection Agency, and that are widely used for benefit cost analysis for all health and safety regulations or evaluations of health and safety. So this one note at the outset, I've used the terms economic analysis throughout here. This discussion is in the context of benefit cost analysis. And I've not provided really in this presentation any background on benefit cost analysis broadly. I'd be happy to follow up with that after the meeting, or in questions about benefit cost analysis broadly. More specifically, our context is benefit cost analysis for environmental regulations and policies, which EPA is required to perform either by statute or by executive order for many, if not most, of our actions. So what you see here is a little bit about the process which gets us to the topic I want to talk about here in this circle, which is how we value these changes in health risks. But it's worth noting that this step in the benefit cost process is really at the end of a long chain of science and modeling endeavors, and requires the cooperation of lots of experts ranging from toxicologists, statisticians, epidemiologists, all kinds of modelers and engineers. But what ideally it gets us to in the analysis is some estimate of the changes in health risks that we expect from a rule or regulation. And then the economist's job, in addition to working in all these prior steps, is to think about how we value those risk changes in benefit cost. So we need to be able to quantify those changes in risk or expected cases or incidents, and then estimate the economic value of those. And what I'd like to present today is to give a quick overview and hopefully convince you that there are well-established valuation methods for providing the values to use in benefit cost analysis that would apply for voluntary standards, for environmental context, for many other contexts. And there are really two types of values: willingness to pay and cost of illness. And I'll talk about each of these in sequence. Next slide, please. First of all, this is from EPA's guidelines for preparing economic analysis. It's a product that our office publishes. And this is the way EPA thinks about human health for benefits analysis. There's a bunch of environmental components, in the remainder of this table, but I've focused here on the human health. And we tend to think of those in terms of mortality risk reductions. That's the reduced risk of premature mortality. And it's from an array of causes, from cancer, from fine particulates in the air. And I use acute fatality to mean from relatively short exposures to something, say fine particulates perhaps. Whereas others are from chronic exposures, long-term exposures to a given environmental pollutant or contaminant. And then we usually separate those in terms of evaluation approach for benefits analysis from what we call morbidity. And this is everything else, all the other health outcomes. And you can see a long list of them here that show up regularly in EPA's analyses. What I'll do today is give you a little bit of a sense of the methods that we use, economists use, to estimate or infer the values that people place upon reduced risks of these outcomes. And I've listed them here, but we'll go through them. We'll go through them in order briefly. Next slide, please. So before we get to the methods, I want to make clear that within the context of benefit cost analysis, that the appropriate measure of value from an economics perspective is this, what we call willingness to pay. And it can be defined much more precisely than I'm defining it here for our purposes. But the question is, what are the people affected? And these, for an EPA regulation, these would be the people who are seeing a reduction in exposures to contaminants. What are these people willing to pay to reduce their risk of this adverse health outcome, whether that's a risk of premature mortality or the risk of one of these other conditions that we saw listed? For voluntary standards, the same would apply for injuries, the risk of some sort of injury. Now, willingness to pay, the economic theory has laid out 4 components of willingness to pay. It's a comprehensive measure of value. And you can see this in the figure there on the right. Some of these may be obvious. It would include, I'd be willing to pay to avoid medical expenses. I'd be willing to pay to avoid loss of productive time, whether that's at the workplace or at home or whatever. But I'd also be willing to pay to avoid having to have my own expenditures to protect myself from whatever these risks are. And that's called defensive expenditures there. And importantly, it would also include people's perceived pain, suffering, discomfort from whatever that health effect is. And so this willingness to pay measure would reflect people's preferences about avoiding all these negative aspects. And so it's a comprehensive measure, and it's the one that economists are seeking to find or to estimate for benefit cost analysis. You recall a moment ago, I separated these, EPA tends to separate health effects into premature mortality and then morbidity, or all the other health effects. For premature mortality, what this measure is, it's a willingness to pay for, in the grand scheme of things, relatively small reduced risk of premature mortality. So it's not the willingness to pay to avoid the certainty of premature mortality. Usually these are fairly small risks in the larger context. And it's usually expressed as the value of a statistical life. And I'm going to take a moment in the next slide to explain in a little more detail what that is, because it's an important concept. For morbidity, it's the same concept, but it's just willingness to pay to reduce the risk of a non-fatal outcome. And we'll usually express that as value of statistical case avoided. Yes, now let's, next slide, and we'll look at this value of statistical life. So if we can walk through this and go to the next. I had sort of animated this in 3 parts here. So let's take this hypothetical to explain the concept. So suppose in a population of 10,000 people, reducing pollution, say air pollution, we have epidemiology leading us to estimate it would avoid 1 premature death in that population. So that is a reduced risk for each person of 1 in 10,000, if risks are evenly distributed across everyone here. Now, suppose, using this concept of willingness to pay, that we're able to estimate, and I'll talk about some tools for doing that in a moment, that each of these people, and we'll assume they're all identical for now, are willing to pay $900 this year to reduce the risk of death by 1 in 10,000 this year for each of them. So what's the total value of this policy of avoiding this thing? Well, it's the $900 per person times the 10,000 people. So $9 million. What is so that is the dollar value of the benefit. What is it actually doing? Well, it's reducing 1 expected premature death. We don't know who it is. And so it's not an identified life, it's a statistical life in that sense. So this $9 million represents the willingness to pay to avoid 1 expected fatality among a population. More precisely, it's the $900 per person willing to pay to reduce my risk by a relatively small amount, 1 in 10,000. And this is a really important number. We'll get to the end. You'll see this drives a lot of the benefit cost analyses at EPA and in a lot of health and safety contexts. Next slide, please. So that $900, where do we get that? Well, economists always want to turn to markets, but of course we don't observe prices directly for health. It's not like people can go buy health or buy a reduction in health risks directly in the same way that you can, buy fish at posted prices. So we can't turn to markets directly for that. So we have a couple of approaches. One, to turn to markets indirectly in a couple of different ways. Next slide, please. One thing we can do is look to see the decisions people are making in the marketplace when they're buying things that, items that might have some degree of risk reduction built into it. This is a hypothetical example, but suppose people are buying bottled water because they feel it's safer. Well, they buy it for a lot of reasons, right? The taste, it's convenient, whatever. But one, maybe they believe, and maybe it actually is in some context, safer. If people are spending money for something and getting a health risk reduction for it, that tells us something about their willingness to pay for that. Now we have to isolate that component. How much are they paying for that particular component? But it tells us something about the trade-offs people are making. And from that, we can infer this willingness to pay. And this can be used, bottled water is just a stylized example here, but it's a lot of studies have looked at automobiles that vary in safety and other products. Next slide, please. A major source for values, particularly when it comes to the willingness to pay to reduce the risk of premature mortality, or what we call hedonic wage or wage risk studies. And this is based on the observation that workers must be compensated, or if they face higher risks at the workplace. So your wage or your salary is composed is driven by many, many factors, one of which is the risks faced on the workplace, the risk of fatal injury and the risk of non-fatal injury. You can see that other box down there. And so in the same, if we can have enough data here, and there are many studies published on this, we can observe, well, how much do workers need to be compensated for how much risk, which tells us something about people's willingness to accept compensation for accepting higher risks, which is the inverse of willingness to pay, but these two measures will be very similar. And this is used widely for the value of statistical life estimates in the US by a lot of federal agencies. Next slide, please. So one option, I'm not seeing the next slide. I'm wondering, there it is. If sometimes though, we don't have related markets we can look at. So another strategy is what's called stated preference. The related markets is revealed preference. People are undertaking some activities and they're revealing their preferences for risk reduction. The other option is, well, let's ask people in survey methods. And this is one example here to the right from Skasny and Alberini, 2018. I have the full citation at the end, where you see you set up carefully. It's a longer survey, and this is sort of just one of the questions there, but you set up carefully, okay, here's a couple of circumstances that vary by their safety or their risks, but they also vary in their costs. Which would you choose? And if you ask people this carefully, again, we can get this sense of trade-off between dollars and risk, which allows us to then estimate willingness to pay. The good news is this can be tailored for your specific case. Next slide, please. So willingness to pay is what economists engaged in benefit cost analysis really would like to focus on and include in the benefit cost analysis, but it's not always possible to get these values through the methods described above. So a more limited method, and this is what a lot of people think of when we're thinking about the value of reducing health risks and injuries, is the cost of illness. And it's usually composed of two factors you can see over here. And those are medical expenses avoided from a given injury and the value of lost time. Now, that value of lost time would include absence or reduced productivity from work. In principle, would also include and should include lost value of household production, doing things to take care of your home and everything, children, everything else you need to do. And in principle, lost leisure time too, that has value to people. And if we lose it due to injury or illness, that loss, has a value. That's often not included. It's more difficult to estimate that. What it does not include, obviously, is the pain and suffering and discomfort and people's willingness to pay to avoid that. So it's a more limited measure and often characterized as a lower bound on willingness to pay. It's certainly an underestimate of willingness to pay, generally speaking. So it's a second best kind of alternative for economists in doing benefit cost analysis. Next slide, please. So just a couple quick notes about applying these things is a lot of the estimates we'll see are in studies and published studies in economics journals and elsewhere, and they often have to be adapted. We use the term benefit transfer. I just put it here in case you see it again, but it means you have to adapt the values there systematically because they might differ from the population of interest in your analysis. The severity of the illness estimated here is different than what you need. There may be timing differences, sooner versus later, kind of health risks. So it must be done carefully and systematically. For premature mortality, this value of the statistical life, most agencies have clear guidance on what VSL, that's value of statistical life, to use. EPA's value is around $10 million. It's consistent with guidance from the Office of Management and Budget that applies across federal agencies. And they're all very similar numbers. They might draw on slightly different literature, but they're all very similar numbers. For other illnesses, there are, at least for the kind of things EPA addresses, relatively few willingness to pay estimates. So in part because all illnesses are somewhat unique in duration and severity and the frequency of symptoms and their impact on health. So so it's hard to estimate. It's expensive to estimate willingness to pay for every single illness. So frequently we're using cost of illness. Final note that willingness to pay and cost of illness may be additive under certain conditions. If that willingness to pay, for example, in a survey, like you saw earlier, didn't include the costs you asked people, just think about the disutility, the pain and suffering that you would avoid, what's your willingness to pay for that. In that case, the cost of illness may be additive to it, but you have to be careful in doing that to avoid double counting the benefits. Next slide, please. So just as an example of EPA's application here, this is from the Costs and Benefits of the Clean Air Act. If you're looking to see, I think, a thorough and well-done benefit cost analysis, this is a good source. And you can see there, so this is looking at the benefits of the Clean Air Act as a whole. So it's all the contaminants that have been reduced through the Clean Air Act. You can see all these health effects. Several of them are valued using willingness to pay estimates, others using cost of illness. One thing I draw your attention to, and this is very common in most analyses for EPA, is if you look at the graph there, benefits by category, you're going to see they're dominated by the value of reduced premature mortality, which makes sense, right? It's the most serious possible health risk. And it's also with the value of statistical life is a well-established figure used for that. So this is very common. If there's a premature mortality being reduced as well as other health effects, often the value of the premature mortality will dominate the benefits analysis. Next slide, please. And I think that is, yeah. So that's everything I wanted to present to you today. I'm more than happy to answer questions now or later. And thank you very much.
Thank you, Chris. So we do have a few questions. The first question is, your presentation seems grounded in the model of for-profit healthcare insurance. Have you given any thought to how you would modify this approach to evaluating risk in a universal Medicare for all healthcare system?
The universal, well, I think if we were looking at this, actually, the universal healthcare, it comes up interestingly in some of the survey work done in collaboration with European researchers, where it's a very different health insurance context in a lot of those countries. And so it does mean, for example, some of these survey instruments where you're asking people what's your willingness to pay to reduce the risk of this health effect. In the US, very often people are thinking a lot about, well, what are the effect on my well-being, but also they're thinking a lot about what is the financial impact. And so the willingness to pay values will reflect that often in the US, and much less so elsewhere where you have this, where you have public insurance and a Medicare for all would reflect that. So what that would mean, though, is if you elicited willingness to pay in that context, it wouldn't reflect those the healthcare costs. And that would be the case where you need to be careful doing it. But where what you've estimated in terms of willingness to pay would probably be additive to the savings in healthcare expenditures. And so taken together, those would might be a better estimate of the benefits.
All right, another question that was asked, how does the willingness to pay in evaluating risk approach relate to the impact of voluntary consensus standards on human safety and health?
Yeah, I think it's, I think by the time, I think if I were thinking about a benefit cost analysis for voluntary standards, I think it is the approach that we're taking at EPA for benefit cost analysis is directly applicable. If we can overcome, for example, some of the data challenges that Casey had pointed out, and can then say, well, given the adoption of this standard, here's the change in expected cases of injuries or premature mortality, and we're able to estimate that and project that, then these same tools would apply. We're down to the point where we're estimating risks, and now the economists can come in and say, okay, for that kind of risk, that risk, people's willingness to pay, at least in the economics literature, tends to be about this much. And so I think these tools are directly applicable once we get to the point of being able to project what are the expected implications of the standard for changes in health risks.
Okay, one final question. Got 60 seconds. You mentioned that valuation estimates often need to be adapted for benefit cost analysis. Can you give an example?
Yeah, one quick example using the value of statistical life is a lot of the values we use come from these workplace studies, and what's being observed there are fatal injuries. Right? So it's an accident with where the fatality is immediate or within the year anyway, but usually it's a fatal accident. But a lot of the risks in EPA analyses are, say, cancer risk, and it's cancer fatalities we're preventing. And that's the case where we're usually reducing exposures, but it's some years later that the cancer case itself is avoided because there's some latency time between when you're exposed and when a cancer occurs. So we have to account for the timing differences. The estimates we're getting from the literature are based on this immediate fatality in the workplace, but the application is separated in time between exposure and the event, and we have to account for that time. That's one way we adapt these values.
Well, thank you very much. Appreciate your time today. We will next move on to our next presentation from Iyer from CSA Group, who's going to be talking about the business case. Adi?
Thanks, Scott, and thanks to our hosts for this opportunity. Are my slides up? There we go. Okay, I don't see them. Scott, sorry, do you know if my slides are up, if they're being presented?
I'm sure they are almost there. And
now I see them. All right. Thanks to our hosts for this opportunity, and for all of you for joining us. I'm Adi Iyer with the CSA Group, and talking to you today from Ottawa, Canada's capital. Next slide, please. Today, I'd like to start off by giving you an overview of CSA Group, a deeper insight into our standards development organization and also our mission. From there, I'd like to give you an overview of our standards utilization and impact project. I'd like to focus a little bit more on the why of the project. Why are we doing it, rather than how or the methodology. Next slide, please. Canadian Standards Association, CSA Group, is Canada's largest standards development organization, and we've been in existence for just over 100 years. We're headquartered out of Toronto in Canada and out of Cleveland, Ohio in the US. Along with our commercial subsidiary, our testing, inspection, and certification arm, we have a global presence with 39 labs and offices around the world, and that includes here at home in Canada, the US, Europe, and also Asia. In all the work that we do on our standard side or on our commercial side, we are driven by a common commitment, and that is the commitment to social good. Whatever we do should benefit the world around us. And this is reflected in our mission as well, an important consideration for why we need to measure utilization and impact of our standards. Next slide, please. We are a member-driven standards development organization. We have over 10,000 members, and we serve a repository of just over 3,000 standards spread across construction and infrastructure, electrical, environment and natural resources, fuels and transportation, healthcare and well-being, management systems, mechanical and industrial equipment, nuclear, occupational health and safety, petroleum and natural gas, and public safety. So essentially everything that touches upon all of our lives. Next slide, please. CSA Standards has 4 unique functional areas. One, we facilitate the development of standards, and that standards that support the enhancement of health and safety and the delivery of environmental and economic benefits. 2, our research function continually looks for areas where standards could play a role, now and into the future. It provides evidence and makes an argument for the role of standards, why standards should be used. 3, education. This helps increase the knowledge of standards among our stakeholders and provides guidance on the correct application of standards. And lastly, advocacy, of which the government relations team that I belong to is one part. We drive public awareness of standards, and that includes a government audience. So in all that we do, once again, it informs or it advances our commitment to social good. Next slide, please. This slide kind of brings that together. Our 10,000 plus dedicated members help develop standards in almost every sector of the economy. We have 1,000 plus committees, and we're accredited by the Standards Council of Canada here in Canada, and of course by ANSI in the US. All that we do, again, is driven by that commitment to deliver on social good and to benefit the world around us. Next slide. And this really brings me to the mission of CSA's Standards Development Organization. Our mission is to enhance the life of Canadians through the advancement of standards in the public and private sectors. With a mission that reinforces our commitment to the world around us and the fact that we've been around for more than a century, it really made us sit up and think about our mission fulfillment. Questions such as, are we enhancing the lives of Canadians? What does enhancing lives really look like? And how are we enhancing the life of Canadians and by extension, the world beyond Canada? We needed evidence. We needed repeatable, measurable data that would continually allow us to measure and recalibrate our efforts towards mission fulfillment. And that really is what sparked our project to measure mission fulfillment by in turn measuring utilization and impact of the standards that we've collectively worked on. Next slide, please. So this slide gives you a very brief overview of our project. We are currently looking at CSA standards in the gas and healthcare sectors. So we have about 321 standards that represent just over 10% of our total standards repository. We would like to measure first the utilization of these standards. Who uses these standards in government and in the private sector? What drives them to use these standards? And are these standards being referenced in government documents and where they're being referenced in government documents? And this includes the federal government. So we're looking at Canada only. So the federal government in Canada, provincial and territorial governments, and also municipal governments where standards may be referenced in bylaws. Once we know who uses our standards and how they're used, we will be measuring the impact of those standards, the impact that they've had in health, safety, the environment, and of course, economic impacts. And this is a part that will truly help us answer that mission fulfillment question on, are we enhancing the lives of Canadians and how we're doing so? And the very last step in our project is to track this data and build a trend over time. So whatever we do now, it's not static. It's not something that is going to be done once and we finish it. What we'd like to really do is do this year over year over year, keep measuring the utilization and keep measuring the impacts and build a trend over time. And once we've run through this, this exercise for gas and healthcare, we hope to extend it to the other sectors that we serve and to all CSA standards. Next slide, please. So we have a variety of stakeholders, and our impact on them, it's variable. It really depends on the challenges that they may have. Their challenge areas are the areas where we hope to measure impact. Questions such as, are we making it easier to choose and compare products by increasing the interoperability of products? Are we making products safer and more durable for consumers? Are we providing certainty in fields such as construction and manufacturing, where someone in that sector can easily pick up a standard or has certainty around a standard on how to, for example, mitigate flooding in new communities? Are we truly helping government, legislators, and regulators alike when they begin to think about mandatory requirements, or when they start to think about how to make the lives of how to increase safety in a certain sector of Canada? And then, how are we doing on the environmental front? Do our standards help our stakeholders reach their environmental stewardship goals? Are they helping them reduce their GHG emissions? Are they helping them reduce their pollutants, etc.? And our impact covers health, safety, environmental, and economic impacts, but really it goes beyond that. It measures much, much more. What we hope to do is measure it down to the individual impact level. How does a standard impact me as an individual? How might it affect my child when she goes to the playground where she visits very often? How does it keep her safe? So that's something that we'd like to measure. Individual standards down to the individual level. And I know that sounds ambitious and that sounds quite broad, but that's the nature of this project. Next slide, please. So why are we doing this? From an organizational perspective, this project is very important. The nature of what we're measuring is very important. Knowing where our standards are utilized and what impacts they're having truly helps us allocate resources to increase the utilization and calibrate those standards to make them even more impactful. Times are changing, challenges are changing, and our standards should evolve as well to address those challenges. For example, one of the data points that we're seeking is the time elapsed between the publication of a standard and the first use of that standard. If the time is reasonably short, that's fine. However, if a long period of time has elapsed between publication and first use, we can then investigate why that is, and perhaps allocate more advocacy, perhaps more government relations engagement needs to happen. Maybe the standard needs amendment to make it a little bit more relevant to the area that it's addressing. So those are some of the things that we can address through from an organizational perspective through this project, through the data that we gather from utilization and impact. For our internal stakeholders, this includes our members, staff, and board. Knowing where our standards are being used and if they're delivering on the intended benefits is super important. It helps us improve our processes, our delivery, our stakeholder engagement, and our advocacy. Our impact results may perhaps provide a full view of what we might need to improve. It also provides an avenue for recognition of our work. If we are in fact being beneficial and impactful, it helps us refocus our efforts on being even more effective, even more impactful. So in the gas and healthcare sector, so just in our gas sector alone, we have 800 members and about 10 staff that serve that sector. And on the health and safety side, we have 2,000 members and 15 staff dedicated to that sector. And both those sectors deliver on just over 300 standards. Our project will really help recognize, refocus, and re-energize the work of these individuals that serve those sectors, but more importantly, spell out the benefits they're helping deliver to the world around them. And our external stakeholders, utilization and impact measurement provides evidence of the value of standards to these stakeholders. This is without a doubt important to CSA, but it should also be important to other SDOs who serve similar stakeholders. While our stakeholders individually and in their own work understand the value of standards, we wanted a way to provide repeatable, measurable, good quality data to them. For government stakeholders, this could help guide our messaging that persuades them to incorporate more standards by reference into legislation and regulation. And for the greater industry, our evidence-backed messaging could help greater uptake of standards, all while helping deliver the social good commitment that we're striving towards through our mission. And lastly, our mission fulfillment and the CSA legacy. If we are delivering benefits towards social good in health, safety, environment, and economic efficiency, what can we do better? If we're not having the intended effect, then what do we need to do to recalibrate our efforts? This is the sort of insight our project hopes to provide for individual standards. If we think there is a standard that might help, for example, significantly reduce neck injuries on football fields, and this standard has been published but isn't in wide use, then we can allocate resources to advocate for the wider use of that standard after having measured its impact in real life and comparing it to the intended impact areas. It helps us truly answer the question, how do our stakeholders view us? What does our legacy look like? We know what our legacy looks like in the past 100 years of existence, but now let us guide our legacy for the next century and beyond. And that truly is the intention of measuring utilization and impact of the standards that we work on. Next slide, please. So we're currently in the utilization phase of our project, and we're measuring various data points on utilization of standards in gas and healthcare. And after the utilization phase, we'd like to study specific impacts of those standards. So one phase truly informs the other. And I'll use a standard as an example because this is close to my heart. My daughter is a frequent visitor at the neighborhood playground, as I'd mentioned before. And if we know that CSA Z614, the standard that pertains to children's playground equipment and surfacing, is the most utilized standard in our health portfolio, then we can further investigate when that standard was first used, when was it first referenced, where is it referenced at the provincial and municipal levels, and how widely is it truly used, how many playgrounds use it, etc. And once we've had that data, we can then look at the impacts from the year of first use. At the end of this project, what we're hoping to do is make attributable statements such as, since its first use in 1974 and its incorporation by reference into regulation, CSA standard on playground equipment and surfacing has helped reduce playground injuries by 80%. Again, these are not numbers we've measured, this is just an example. And compare that to the period prior to 1974. So it has reduced playground injuries since 1974 compared to the period prior to 1974. So understanding the utilization helps us measure impact in meaningful ways, and measuring the impact helps us improve and deliver more benefits. While we understand that standards may not be the only beneficial solution to deliver impacts, we do know that they can be an important tool in the toolbox that helps improve the world we live in. Next slide, please. And this is my very last slide, and it gives a brief update on where we stand with our project. We are in phase 1, currently going through the results of utilization. We'll embark on phase 2, measuring impact in November. And by the end of March, we hope to have devised a method to track utilization and impact on an annual basis so that we can build a trend over time. Once we've gone through that exercise in a limited way with the 321 standards on gas and healthcare, we'll be expanding that to the other CSA standards that we have. And once we've completed this project, by March, hopefully, I hope to share the results of it sometime in the future as well. For now, though, I'd like to thank you once again for this opportunity and your time, and I'm happy to answer any questions you might have. Back to you, Scott.
Thanks, Adi. So we have a couple of questions that have come in. The first question I have is, do you expect knowing the impact of a standard will help CSA choose standard development priorities?
I think in a way, yes. So if there is a standard that we worked on, it hasn't been used, we've gone out to stakeholders and they don't see as much purpose for that standard anymore, if it's not as relevant anymore. And if it isn't having the intended impacts because it hasn't been used, then you might want to take another look at that standard and see if we can make that standard perhaps more impactful. If we can amend it and make it more impactful. If it's not relevant to the world we live in, then maybe it's not a great idea to support it.
How does CSA propose to collect so much detailed data from so many individual users?
So on phase one of the project, what we've done is, and that's a fantastic question because that's something that we struggled with when we were scoping for this project as well. So we've divided the project in three parts, and there is a reason for it, looking at utilization first. And even in just looking at utilization, the sources are vast and diverse. So we contracted this out to a reputable consulting firm. Our deliverables are very prescriptive in that we know exactly the data points that we're looking for. And as we look at impact, I think we'll be looking at a large sample size as well, but based on the results from phase one. So what we've seen in phase one so far is, and not sharing results here, but what we've seen or what we've scoured for in phase one is all the provincial, federal, and municipal government websites and the documents that they put out, known large utilities that may be using gas standards, industry associations. We've gone out to nonprofits, and we've used artificial intelligence through our collaborators, third-party vendor, to scour the information out on whatever is available. So yes, it's a very big sample size, and we've now received data points that are vast and diverse, and we're going through those. But it's a combination of using cutting edge tools, so AI, and going out and doing traditional surveys.
Thank you. Okay, another question. Can you share your timeline for your overall project?
Yeah, so we first started. We first got the project team got the project kicked off sometime in May, and we went through the RFP process and went through the scoping process. So our consultant had 8 to 10 weeks to deliver the first phase of the project. The second phase, which is the impact study, I imagine will take similar time. So we're hoping by the end of January we'll have some results on that. And in February and March, we hope to devise a method to collect data from phase one and phase two on an annual basis. So between now and the end of fiscal year, we hope to finish the project.
And finally, one last question for you. Will the study be extended to other sectors?
Yes. That's the resounding answer. So what we wanted to do was test this out in a limited way with just gas and healthcare, and then extend it out to other sectors if we were happy with our methodology and our scope, and if we were truly getting the data points that we hope to get. So we will be extending it out to other sectors, but that'll be the next fiscal, so 2022 and beyond.
Well, thank you very much for your time today. We really appreciate it. We'll move on to our next presentation, which is going to be a joint presentation from Ray and Amanda, talking about the healthcare industry and giving us a case study. So Ray and Amanda, I will turn it over to you.
Okay, thanks, Scott. We're just waiting for the slides to come up here. Okay, well, in the meantime, hi everyone, I'm Amanda Benedict. I'm Vice President of Standards at AMI. So many thanks to ANSI for inviting us to be part of today's discussions and presentations. And thanks to all of you for being here. I'm very excited to be co-presenting with Ray Peng of the US FDA. Today we're going to be talking about the IEC 60601 series and getting from basic safety and essential performance to safety and effectiveness. We can go on to the next slide. My part of the talk is just going to be presenting some fundamental information and background to help set the stage for Ray's part of the talk. So we can go on to the next slide. In particular, I'm going to be covering what the IEC 60601 series is, how it came to be, and who's responsible for developing and maintaining it, and also teeing up why this series is important to medical electrical equipment industry and regulatory before we transition to Ray. We can go on to the next slide. The shorthand description of the IEC 60601 series is engineering safety standards. This series of standards provides general and particular requirements for the basic safety and essential performance of medical electrical equipment. And I should mention that in this context, medical electrical equipment is devices that are powered with a plug or a battery and come in contact with the patient or are involved in the transfer of energy or its detection to or from the patient. The intent of this series is to ensure that there is no single failure, whether it's mechanical or electrical or functional origin, that poses unacceptable risk to patients or the operators of the equipment. The foundational document, IEC 60601-1, which provides general requirements, was originally published in 1977 as IEC 601-1 and has been continuously reviewed and updated over the years. The designation was changed to IEC 60601-1 in 1988, with the second edition being published. And the third edition, which is the current edition, was published in 2005. And that followed a thorough review of the series, of the document. And this particular edition represents a restructuring, a strengthening of the risk management content requirements, and also the addition of the concept of essential performance into the series. So this series of standards consists of the general standard, which gives general requirements for the series and applies across all medical electrical equipment. 7 collateral standards, which are designated 60601-1-X, and about 70 plus particular standards, which are designated 60601-2-X, and then there's some that are ventilator equipment, which are 80601-2-X. The collateral standards are what we call horizontal standards. They apply across medical electrical equipment types. They address hazard concepts such as usability, electromagnetic compatibility, environmentally conscious design, and so on. The particular standards modify and tailor the requirements of the collateral and general standards, and they apply to specific equipment types such as non-invasive blood pressure monitors, internal pacemakers with internal power sources, and so on. Where there are applicable particular standards, the requirements of these standards take precedence over the general or collateral standards. So this series of standards is developed and maintained under IEC Technical Committee 62, which is Electrical Equipment and Medical Practice. And this TC has 4 subcommittees. IEC Subcommittee 62A is responsible for the horizontal standards, and so the general and the collateral standards. IEC Subcommittee 62B through D are responsible for the particular standards. And the structure and scope of the TC and the subcommittees is left deliberately flexible to accommodate future evolutions of medical electrical equipment. Now, Amy is very fortunate. We administer the secretariats for subcommittees 62A and B, and the U.S. tags to TC 62 and subcommittee 62A and B. My colleagues Hei Cho and Ladan Bullock-Bushi work directly with those groups. The IEC 60601 series of standards is recognized around the world. They're not only crucial resources for industry for the design and development of medical electrical equipment, but they're also necessary for regulatory compliance in many markets around the world. So at this point, I will transition to Ray.
Thank you, Amanda. Next slide. Thanks, Amanda, for this introduction to the structure and the working groups corresponding to the IEC 60601 series. Hi, my name is Ray Peng. I'm overseeing standards work in multiple areas for Center for Devices and Radiological Health. And also I'm representing the center at various standards committee, for example, US TAC for IEC TC 62, which develops and maintains this 60601 series. I'm very glad to have this opportunity to share with you about standards and the FDA and how we are getting from standards basic safety and essential performance to device safety and effectiveness. Next slide, please. Since engineering safety standard is at the heart of the matter today, so let's start by reviewing where IEC 60601 fits into FDA's pre-market review of medical device safety and effectiveness. The 60601 series is a large and complex body of work, often not well understood by many stakeholders in the medical device sector. The AAMI Consensus Report CR 500 was developed to help FDA stakeholders to understand the underlying concepts of the standard, and this diagram was taken from that document. When the 1938 medical device law was written, it was based largely on the existing system for regulation of drugs, which traditionally focused on the right side of the diagram. But there's a fundamental difference between drugs and devices that perhaps wasn't fully recognized at the time. When clinicians think about safety and effectiveness, they focus on patient outcomes, positive and negative, that result from the intended use of the device. For example, one would like an ablation device to kill 100% of the cancer cells while causing no collateral damage to the surrounding healthy tissue. The extent to which it cures cancer is an effectiveness issue, while damage to healthy tissue is a safety issue. And Cdrh, as an institution, is renowned worldwide for its ability to weigh and balance these issues. However, while there's not much you can do to change the design of aspirin and still have it be aspirin, there are a great many engineering aspects of the typical medical device design that bear on safety and performance. These need to be examined during pre-market review, as shown on the left side of the diagram. For a medical device to be safe, it shouldn't cause direct physical harm to people, property, or the environment. So it shouldn't electrocute patient or the user, it shouldn't start a fire, or have heavy parts that break off and fall on the patient. And no single failure of the device should lead to an unsafe condition. Those two principles are the basis of IEC 60601. In addition, it is well understood that the manufacturer must provide evidence that the device achieves the performance necessary to fulfill the intended use. This last principle is outside the scope of safety standards, but another aspect of the evidence. Much of it obtains through testing, and a lot of times to other consensus standards that the manufacturer must provide to support a claim of safety and effectiveness. The bulk of the testing performed on the left side of the diagram is non-clinical bench testing to confirm all relevant aspects of engineering performance. There's usually also some clinical testing performed under real-world or simulated use conditions. These tests are designed to focus on aspects of engineering performance rather than clinical outcomes, and should not be confused with the clinical trials used to develop evidence for the right side of the diagram. Now that you can see that the assessing conformity to IEC 60601 is an important element of establishing the claim of safety and effectiveness in our pre-market review in principle. Let's take a closer look at example. Next slide, please. This is from a relatively recent pre-market submission. The device was the airway pressure monitor, often used to ensure that the lungs of a pediatric or neonatal patient are not overinflated when they are being mechanically ventilated. This setup will often be used by anesthesiologists during surgery. Please note that the figure represents just a typical use of this kind of device and does not indicate a particular device or manufacturer. The diagram shows that the device may be used as a component of a system to deliver oxygen-enriched air to the patient. The instructions for use accompanying the device even included a warning not to smoke in the vicinity of the device. And yet, when our reviewer looked at the ES 60601 test report, it noticed that under the main fire prevention clause, the subclause 11.2.2 titled ME equipment and ME system used in conjunction with oxygen-rich environment was marked NA, not applicable. But that clause addresses risk of medical electric equipment used in oxygen-enriched environments, which happened to be this one. When we asked the manufacturer about this, they replied that the enriched oxygen is contained within the patient breathing circuit and not in the ambient environment in which the device is intended to be used. They also asserted that there were only 3 components inside the device that were exposed to enriched oxygen: an inlet port on the enclosure, the solid state pressure transducer mounted on a circuit board inside the device, and a short piece of tubing connecting the two. They asserted that all of these components were robust and not reasonably subject to failure. However, with the careful reading, clause 11.2 indicates that the clause was intended to address risks due to the presence of enriched oxygen inside as well as external to the device. Moreover, a photo of this device interior, which we can see now, showed that the tubing was press-fitted onto typical bar fitting at both ends. While the 3 components might be unlikely to fail individually, What about the reliability of the tubing connections? Our reviewer also noticed that the tubing ran directly across the surface of a lithium-ion rechargeable battery. What happens to the tubing containing oxygen-enriched air under modest pressure should the battery experience an internal short, leading to excessive heat? When confronted with these concerns, the manufacturer voluntarily agreed to revisit their risk analysis. Ultimately, they decided to remove the power supply, including the rechargeable battery, entirely from the device and house it in a separate enclosure. That was a significant redesign to undertake at such a late point of the product development cycle. It would be much more cost efficient had this been found out and corrected earlier during the testing to the standards. Next slide, please. Now that we have seen how engineering safety standards 60601 series can help both medical device design as well as our regulatory review process in real world, you may ask, how would FDA and Cdrh make sure voluntary consensus standards utilization can appropriately reflect our regulatory needs? In Cdrh standards program, we're managing this total standards lifecycle, I often say, with three major pillars: standards development participation, standards recognition, and the standards conformity assessment. We started early on, getting involved in the standards development process, and our FDA liaisons will bring our regulatory perspective into the standards development phase from early on, and therefore, a lot of the standards published as a result of this level of participation can move into recognition discussion. Our key component in this direct standards management operation is called specialty task groups, which aligns with our regulated device areas, from horizontal aspects such as quality system, risk management, to the specific device types. The STG members are the subject matter experts in regulatory policies and technical aspects from different offices across the center. And we ran the consensus building process throughout the life cycle of standards development and recognition. From the early on, the prioritization of participation to selection of Cdrh liaison, all the way to the recognition discussion. Once the standards are recognized, sponsors have the option to submit declaration of conformity to them, which may reduce testing data required in submission. And currently we recognize about 1,400 standards with about 5 to 10% increase annually. And from our internal data study a few years back, average about 7 standards cited in each 510K. So now that standards are recognized, now what? We need to put standards to work, which leads to another important component and newest component to our total standards lifecycle in the program, conformity assessment. Through the promotion of conformity assessment, we're trying to enhance the use of declaration conformity in device submissions. And we started the ASCA pilot, which is short for Accreditation Scheme for Conformity Assessment, to help with this initiative. Throughout the ASCA pilot program, we want to enhance the confidence in medical device testing and promote consistency and predictability in pre-market review. Also, we want to encourage effective use of FDA resources and support international harmonization. Next slide, please. The use of voluntary standards in Cdrh covers across the total product lifecycle. For pre-market side, standards have been cited in all types of submission, 510Ks, PMAs, IDEs, etc. Use of standards is voluntary unless the standard is incorporated by reference into our regs, and then it becomes part of the mandatory requirement from the regulation. And standards can be used with declaration conformity, which only for the recognized standards, the general use, which is for any type of standard that you choose to use, recognized or not, or you can mix and match. In post-market, we have seen standards being used for root cause analysis for MDRs, also in post-market risk mitigation. Next slide, please. In this presentation, we have talked about the connection between 60601 basic safety and essential performance and our safety and effective review policy today. A few things noteworthy. Engineering safety standards, the IEC 60601 series, provide a good evaluation protocol for medical electric devices, basic safety, and essential performance. Regulators benefit from the use of standards to review devices' safety and effectiveness. And FDA and Cdrh total standards lifecycle management promotes the use of voluntary consensus standards in regulatory process. And last, I want to thank you all for spending time with us, and I'll be okay to answer any questions if the audience have any. Thank you so much. Back to you, Scott.
Thank you so much, Amanda and Ray. So the first question I have is IEC 60601 is a huge and complex series of standards. What resources exist to help manufacturers and regulators identify and use the applicable parts?
So from an industry perspective, Ray mentioned that there's the AMI consensus report, CR 500, which is basic introduction to the IEC 60601 series, and that's intended to explain the importance of the series and clarify how to navigate and implement the parts of the series. There's also guidance documents or technical reports that have been developed under IEC Subcommittee 62A that help with interpreting and applying the requirements of the series. Those are designated IEC TR 60601-4-X. So these are geared more towards industry. Ray probably has some thoughts about resources that help with conformity, assessing conformity.
Right. As I mentioned, we started this ASCA pilot, which is a accreditation scheme for conformity assessment, and we have published several final guidances on this topic, and one being the basic safety and essential performance track. That guidance was finalized and published September last year, and it's mainly for the ASCA utilization and for the testing labs and the sponsors who are willing to participate for this track. That's mainly for this IEC 60601 and 80601 that were recognized by us.
Okay, next question. Ray, can you clarify how the FDA gathers data on standards recognition, assessments, and clinical performance?
So for the standards recognition, we are pretty open. We have several pathways for this information to be fed back. One is our liaisons, which are sitting out in the SDO's working groups, and they develop new standards, new projects. And a lot of times, because it was already prioritized that the relevance and importance to the center is already justified. So these newer standards can be brought back by the standards liaisons for recognition. Also, the reviewers internally, when they see in the submissions, there are some standards of being referenced and cited, used frequently enough, and yet we not recognize that. That's kind of another tips for the program to say, hey, something that's off our radar and now comes in being used widely. We need to take a closer look and to see whether it's appropriate for recognition. And another pathway is actually a very open pathway. Based on 21st century cures, now we actually have a standards recognition request pathway that anyone outside in the industry, in the standards community can send in an official request as long as it contains the sufficient information, the title, the version, and so on and so forth, to our email address. And then by law, we need to provide an official response within 60 days. That whether we recognize it or not. As for the utilization data, what we had done is data mining projects. We used our internal database, the 510Ks and PMAs. We did some keyword search just to see what are the standards being used. How many. That's how we came up with the average number and so on and so forth. And also we had we're aware which standards are cited most frequently. The top one is 10993-1. And I think 6061-1-2, the EMC collateral standard, is actually on top 3.
Okay, and one more question for you. How do you appropriately use declaration of conformity when using recognized standards?
That's a great question. So when you take a look at the 2018 appropriate use of consensus standards guidance we published, we identify several scenarios for declaration of conformity use. A common misconception is that a DOC is just a one page indicating that I declare conformance. Not necessarily. So that it varies depending on the types of the standards you're using. So for the standards that, for example, contains a very clear testing method and clear acceptance criteria, yes, you can do a one-page declaration of conformity. You don't necessarily need a supporting documentation. But the supporting documentation increases, when the standards are being less in details. For example, if you have a standard only contains a testing method or only contains acceptance criteria, then you start to need supplemental information accompanying the declaration of conformity so that the reviewers can know, okay, these tests are being done and this is a summary of the test report. And for some standards, take an example, AMI HE75, which is a human factor standard. That one, it's recognized, but when you do a declaration of conformity, we would want you to take a closer look at additional regulatory requirement from our human factors guidance. That guidance had a very detailed testing report and testing data submission format, which is slightly different from all other human factors standards. So in that case, we want to make sure the sponsors understand that the use of voluntary standards only fulfill part of the pre-market requirement. We encourage you to take a look at the relevant guidance, relevant regulations, and also reach out to the corresponding review divisions for any additional regulatory requirement. So for example, this one, the review division had a very specific requirement on how you want to do a human factor test and submit the data. So, we want you to also put that into consideration when you submit the testing report.
All right, thank you very much. We appreciate your time today. We are on schedule here. We have one more presentation this morning. Actually, we're now in the afternoon, this afternoon. This is from Tim Fisher, who's going to give us a case study from the workplace world. Tim?
Thanks, Scott. Quick sound check. Did I sound okay? Excellent. All right, so it's good to know that I'm the only thing that's keeping people away from lunch right now. So I'm gonna go. I got about 82 slides. Now we're gonna have a quiz afterwards, but we're gonna shut it down a little faster. And so what we're gonna do, really, I'm Tim Fisher. I'm with the American Society of Safety Professionals, and it's my honor and privilege to be here today to follow up on really some interesting presentations and some really great information. Now, if you read the materials in the case study, what I'm going to talk about is lagging and leading indicators as a case study, and I'm also going to pull in what ASSP has done with management systems. And hopefully, what we're hoping is that you're going to get some value out of this, because what we're trying to do is show an actual case study that we did as far as an organization about measuring the impact of consensus standards on human health and safety. And I think we did that. Next slide, please. I don't want to get into the history here because people can look at this when they want. I'll just say ASSP has been around for 100 years. We have about 120 standards and projects. And I would say we're probably about a mid-level standards developing organization. Next slide, please. Who am I? I've already told you, I'm Tim Fisher. I've been in standards for really almost 40 years. And I'm glad to be here today and hope to make a contribution. Next slide, please. So what's the point, really? Now, that's the thing to remember. What is the point of what we're talking about today? And that is, can we show the value of standards? And why do people care? Now, I would say one thing. This is one thing we hear an awful lot from stakeholders and occupational safety and health professionals, or we call OSPROs. We hear this all the time. What's the point of these standards? And I get this all the time. Now, they use a different word, obviously, but I'm going to use the word malarkey. So we get a lot of these, which is like, your standards are a lot of malarkey. Can you prove that they have value? Can you show that they will impact occupational safety and health? Why should we use them? We have regulation in government. Why do we need your consensus standards? Can you make your case? And I think we did. I think we have. So it's a big topic, as I said, and this is something that ASSP really has spent a lot of time the last 3 years. And the reason why we did this was because we had literally hundreds of inquiries that came from OS professionals, engineers, and higher levels of management and operational people that said, hey, we don't need your standards. There's plenty of things out there with the government. It's a lot of malarkey. We don't need to do this. Show us the value. Show us how does this impact safety and why is it a good thing? And that's what we did. So if you look at this slide, that's what we're trying to show on this one. And is there any data, and this is going to be something I'll get into in a little bit, outside of ASSP that's talking about it? What's the value here? And we're going to say yes. Yes, there is. And there's going to be 2 case studies here that I'm going to talk about, and it's all going to lead in then to the issue of leading indicators and management systems and how we think we made our case. Next slide, please. So our first one is our Occupational Health and Safety Management System standards. And I'm really going to talk about 2 standards, which you see on here. And that's our ISO 45001 standard, that's Occupational Health and Safety Management Systems. And the other one is our Z10 standard, which is also a standard for Occupational Health and Safety Management System standards. Now, I'll argue if I talk to every single person on this call, on this meeting, every one of you are going to say, yes, you want to have management systems in the workplace. We want good safety and health, all that good stuff. I don't think anybody is going to disagree with me on that. The question is the issue of standards, implementation, cost, and return. And that's what we hear a lot about. So what we did is we put together, I would call an extensive report. And people want that. My contact information is at the end. I'll be more than happy to send it to you. I gave it to ANSI too. I don't know how quite we'll distribute it, but I'm more than eager and to pontificate and send it to you if you want to see it. So we put together an extensive report. And what did we do really is we want to really show demonstrated solid reasons to implement these systems. And we did want to acknowledge that more has to be done. And if you look at it, what we did is we did a combination of anecdotal information and data. Now, I'm not going to sit here and tell you that our data, we heard earlier from some of the economic people, I'm not going to sit here and claim that our data is going to beat some of the things that we saw today, but we do think that we made a good case. Now, we've given out this paper to over 10,000 requesters. Now, think about that. I know for some of the organizations, that's not a lot, but to ASSP, it is. So we've given out about 10,000 of these papers to our requesters. And why we did that is we probably had about 500 objections to the standard. After we sent that paper, and I think this is an important point to make, we did not have one organization that came back to us and said, you didn't make your case. And I think that's a good thing. And I think one of the issues that we're trying to talk about on this meeting today is how do we show the value? And that's what we tried to do. The response to our paper has been completely positive, and we're working on another study right now, and that's going to deal more with the return on investment. Of interest, and this we think is very important, is the U.S. Department of Labor is doing a study right now on the value of standards for occupational health and safety management systems. And they're doing a lot of work with our Z10 and 45001 standards. So the government is using materials that we've done before, and they're going to continue, hopefully, to come out with some additional data and material on that we can use as well. And that's what we're trying to do. Next slide, please, sir. So what are we trying to show with this one? I mentioned the study with the DOL, and we did issue a comment on that as well. And we think that our paper is going to do a lot. Also, what happened is some of the people that were doing the studies and research on it, as far as the interviews, we let them come to our professional development conference. We set up rooms. There was a series of roundtables and things like that. And so what we think is going to happen, or we hope is going to happen, is that the results of what's going to come out of the government is going to support what we have had in contention for a number of years. Also, if anybody here follows the U.S. Mine and Safety and Health Administration, in September, they published a proposed rule on mobile equipment. Of interest on that is that they cited our Z10 and 45001 standards and our paper. And they specifically said that based on some of the things that they had seen, that we were able to make the case that occupational health and safety management systems and the standards, by that I'm saying Z10, 45001, I'm specifying those two specifically, that they make a difference. And I think that's a good thing. And I think is a good indicator of some cooperation, some collaboration between both the private and the public sector on this one. So that's what we're looking to do. And then what we want to do is we're looking to do more future and private sector implementation of these standards. And this is something that I have heard a lot on, which is, okay, you've made a great anecdotal case on this. but you still need to do more as far as implementation data. What's the final result? And I think that's a true statement, and I believe that is a true criticism and a correct criticism, but you're going to see more on that as time goes on. So what were we trying to show you with this first portion here is we had a lot of naysayers out there as far as ASSP goes. We had a lot of organizations and stakeholders saying these standards, they're good, but you can't prove that they have any value. And so what we did is we went out there and we did a lot of interview studies, data gathering, literature collection. Then we put together what we call a white paper or a support paper. And that's what we've used. We've given out about 10,000 of these. And as a result, I think we built somewhat of a solid case now for the use of occupational health and safety management system standards. Of interest also is that it's also been used on the global stage as well with ISO, because we are the U.S. technical advisor or the tag administrator to ANSI for ISO TC 283. That's management systems for safety. And also, we also have the risk assessment tag, and we use that paper also, I think, effectively in that area as well. Next slide, please. The one thing I'd say, I don't want to spend too much on this slide, but a couple things that I think would interest people on the call is that management standards are continuing to grow. And so that's one of the reasons why we worked on this so much, because we wanted to show the value. And so that's what you're trying to do. Two is the other big issue, which we're seeing right now. And I'm saying this is what management system standards and standards overall. And I'm going to say it's the measurement and the use of the definition of risk. This is something that we've seen so much on with the occupational safety and health. I've seen it with a lot of engineering standards now, risk assessment, risk management. ANSI's been working on this. So I just want to point out. And once again, it's a repeat that we're looking to do more private and public sector implementation of these standards. Next slide, please. So let's lead into our second case study. And this one here is on leading and lagging indicators. And what do we mean by that? And so we have a committee at ASSP. It's called our Z16 committee. It's a very strong committee. It's about 60 organizations. And what they're working on is to create leading indicators, which can be used to improve occupational safety and health. Now, lagging indicators, and I'll hit this in a couple slides also, has always been historically what we've seen. So for example, the US government regulatory record keeping is based on a lagging indicator. You know, how many people got hurt, how many injuries. And so what we're trying to do as an occupational safety and health organization, working with our stakeholders, is come up with new ways to look at the workplace and come up with ways to try and prevent these instances from happening up front. Next slide, please. So it's interesting on this one. You say, Tim, you're talking really out of both sides here, because on one side, I talked about government using lagging indicators, but now I'm quoting OSHA, which is a fair criticism of. But I do think, and I'm not going to go ahead, I'm not a slide reader, so people can read this slide. But what am I trying to say with this, and what am I trying to show? And that is, we're trying to show that there is a change in occupational safety and health, and I would argue in safety overall, and which I think also is one of the themes of what we're talking about today. And that is what we're trying to do, is we're trying to get out in front, we're trying to be preventative, and we're looking at ways to correct occupational safety and health issues and safety incidents beforehand, not after they happen. So don't get me wrong, we want to do good evaluations, and we want to do good assessments and incident investigations. But I don't think anybody's going to argue with me that we want to prevent that. If we don't have that situation, if we can prevent it up front, then we don't have to do that. And so that's what we're trying to do with Z16. So what I'm showing up here on this particular slide is what the government has said on leading indicators and why they're so important. And I know ASSP, we're proud to be leading that issue. Next slide, please. So this slide here, and what am I trying to show on this one? So two case studies. You know, once again, what's the point? What are you trying to show here? So in terms of workplace health and safety metrics, and I talked about this earlier, they're really divided into two areas that I talked about, and that's leading and lagging. I know it's a little bit of a repeat of what I already said, but this is an important thing, because if it's one thing that I hope I get out to everybody today, so we're talking about the measurement of safety and the value of safety. We want to look at it ahead of time. And so, okay, great. We can find out what happened after the fact and calculate losses and indirect and direct loss and cause. And then we can go out, we can find out what the root cause was. And that's all important to do. I've been working in safety for 40 years. So I totally understand that's what we want to do. We want to do that engineering assessment. That's something we want to do it. But what we want to do is also come up with ways to try and prevent that as well. And so that's what we're doing with Z16. do I think we've made our case on that as far as measurement goes and the concept of what we're talking about in this presentation? I think that it leads into what we've done with management systems. And I do think that if you look at some of the data that government has said, specifically from the National Institute of Occupational Safety and Health through the Center for Disease Control, some of the stuff from OSHA and what we've done, I do think that we've made our case somewhat that we want to work more on leading indicators. The question is, what are they? And that's where it's going to get dicey. What's the indicators that you want to use? So next slide, please. So as I talked about, 2 case studies. What's the point and what's the feedback from our work on Z16 and leading indicators? One, we want to prevent injuries and illnesses at companies. And I would say also, one correction to my slide, and organizations. That's what we want to do. We want to prevent injuries and illnesses at companies and organizations. We want to reduce cost associated with adverse events. Now, there's been a lot of things in the news. We've seen some things recently. But the one thing I did say is when we talk about cost, direct and indirect. So we could talk about that. We could have a whole presentation, a whole symposium on the issue of direct versus indirect costs with incidents. And that's something that I know we just don't have the time for, but I think it's an important thing. And actually ASSP has done quite a bit of work on that. And that's one of the things that we also used when we did some of our justifications for what we did with Z16. And I think we made our case on that one. We want to improve safety and health performance. Once again, this is something I think it's important to talk about. So I'm beating a dead horse on this one, but I'm going to continue to beat it because this is one of my big themes here, which is what I want to talk about when we're talking about measuring safety and how safety and health impacts and what the return is. We want to improve safety and health performance. And so to do that, I argue that you got to be forward thinking. Lagging, it helps. I'm not saying it doesn't, but you got to look forward because you can't correct a situation unless you know before. And I would say one thing, I've probably investigated 1,000 incidents in my career. And out of all the ones that I've seen, I'm going to argue that just about every one of them, that there was things that took place before it happened. And that's been my experience. I know there could be somebody on this call that says, Tim, I disagree with you completely. And there's so many ones that cannot be predicted. I'm not going to say it never happens, but from my experience with many investigations, the vast majority of ones that I've seen, there are identifying things that took place before. The other big one we want to do is we want to increase worker participation in occupational safety and health initiatives. In other words, we want to get all the organization involved, not just the C-suite, not just the engineering department, not just operations. We want everybody to join together. And if it's one thing I think that there's been plenty of data and information on, we talk about standards and standards development, is that an organization performs better, specifically in safety, when we have the whole organization involved. So we've seen many studies from that with the government. I know our own experience within ASSP has been very supportive of that as well. So next slide, please. So what am I going to do today? So what they said today is basically, and I think I'm right on time. What did I say? We wanted to talk on occupational health and safety management systems as a case study. I want to give you a case study on what's going on with leading and lagging indicators, pull them all together. And what we've done now is we've used that, I think, to go out and educate at least the stakeholders that we deal with. I believe we've had some success. I'm not saying it's been perfect, but if you want to see the materials that we have and that we've used and that we've shared and has been used in both government and global and all that, you have my contact information here. Feel free to contact me and I'll be happy to send it to you. So back to you, Scott.
Thank you, Tim. We are right on time, as you pointed out. Good job, everybody. I think we have enough time maybe to ask one question of you, Tim, real quick.
Yes, sir.
Not really a question, but could you expand upon ASSP's methodology for gathering data on Z10, ISO 45001, and Z16?
I can't. So what we did is basically, I don't want to say that that we had this amazing methodology. What we did is really 3 things. 1, we went out and did a literature search. 2 was we went out and did a data search for where we knew data existed. And you know, ASSP's been around 100 years. We publish a journal, all that good stuff. So we have a lot of that material anyway. And then the other thing we did is we went out and talked to our members and looked at some of the other sources. What we did then is we compiled all that information into our paper. We put all that together. We then had it looked at. It was edited. And then what we did is we actually went out and had a peer review, because that I think would have been a very legitimate criticism. Is okay, ASSP, you put this paper out, and big deal. Who looked at it? We had about 100 OSH professionals look at it. A lot of them are from academia and government, and I do think that's an important thing to know. So that was our methodology. I'm not claiming that it's going to meet I know that there's going to be some type of academician or something or really knowledgeable on this and say, hey, you screwed up this step here. I would say there's probably some fact to that, but we think we put a pretty solid paper back together. Back to you, Scott.
All right, one more question for you. So on your paper, you have a lot of good anecdotal evidence-based information, but are you sure you've proven your case via the data? Are there more steps you can take to better back your contentions with the data?
I would tell you this, Scott, it's a fair question. I think we make a very good anecdotal and evidence-based argument for the use of standards for occupational health and safety management systems. Do we have some data? Yes. Do I think our data is probably completely adequate? No. And so what we're hoping is what's going to come out with the Department of Labor, that we're going to see more definitive data that we can use. We are looking at doing some additional studies through our foundation, perhaps down the road. There has been some good stuff done globally. That doesn't necessarily equate to the US. So I guess I would tell you yes, no, but there's still work to be done. Back to you.
Thanks very much. So appreciate your time this afternoon now. We started this, actually for you, it's still morning.
It is.
Thank you so much. Thank you to all of our presenters for this first portion of today's meeting. At this point, I will turn it over to our MC, Jim McCabe, and remind everybody that this is a three-part meeting, and we will take a break and reconvene for part two after everyone's had a chance to grab something to eat.
Thank you, Jim. Welcome again to this afternoon session associated with measuring the impact of voluntary standards. Our intent for this afternoon is really to build upon the presentations that were heard earlier this morning that provided a wide variety of points of view on how to measure the impact of standards, why this topic is important, and so forth. And so really, we're looking forward to just continuing that conversation that was started this morning as we began. So I'm going to introduce our panelists for this afternoon, some of whom you heard from this morning, others are new to you. But first, let me introduce Amanda Benedict. Amanda is the Vice President for Standards at the Association for the Advancement of Medical Instrumentation. Amanda previously served 2 terms on the board of directors of the Society for Standards Professionals, also known as SES. And in August 2020, she was honored with the Lauren K. Wagner Memorial Award from SES and CSA in recognition of her outstanding contributions to that professional society. Randy Cooper is the Vice President of Technical Operations at the Association of Home Appliance Manufacturers, or AHAM. In this role, he's the staff leader on a host of technical and regulatory issues, including liaison with safety and performance standards organizations. Randy is also a certified black belt in Lean Six Sigma. Tim Fisher is the Director of Standards and Technical Services at the American Society of Safety Professionals, or ASSP. Tim has a veritable alphabet soup of certifications, including Certified Hazardous Materials Manager and Certified Professional Environmental Auditor, and 5 more. He's also an Air Force veteran. Casey Granata is from Underwriters Laboratories and is a Standards Technical Panel Chair. He's responsible for driving standards, improving processes, implementing emerging technology, and reflecting current marketplace issues in standards. Don Huber is a principal at Compliance Program Services. He has extensive experience in the areas of quality management system development, industry-wide safety standards development, regulatory compliance, risk management, and hazard analysis and prevention. Mr. Huber's experience includes juvenile products, toys, medical devices, and consulting. Chuck Johnson is the president and CEO of the International Safety Equipment Association, the trade organization for personal protective equipment and technologies. His responsibilities have included federal affairs, environmental regulation, occupational health and safety, community and consumer protection, international regulation, and sustainability. Doug Morton is the Vice President of Government Relations for the CSA Group, where he joined in 2008. He has over 30 years of executive management experience in a variety of market sectors, including healthcare and telecommunications, with internationally renowned companies such as Siemens and Bell Canada. He also has extensive global experience, having completed assignments in both Europe and the Middle East. Elise Owen is the Environmental Protection Agency's Standards Executive, coordinating the agency's use of and participation in voluntary consensus standards as directed by federal law and policy. There are over 4,500 references to standards in EPA regulations, and more than 100 EPA staff participate in the development of standards on topics ranging from pesticides to water conservation. So thank you all for being part of our panel today. And because some of the people and organizations that we have in the panel today were not part of the morning presentations, I'm going to offer the opportunity for a couple of our panelists to introduce themselves directly and talk a little bit about why they're part of the discussion this afternoon. So first, let me turn that over to Randy Cooper.
Thank you. If you want to go ahead and pull up my slides and go to the next slide here, I'll just quickly introduce you to the Association of Home Appliance Manufacturers. We are a trade association representing major portable and floor care appliances. We cover both the US and Canada as a trade association, and we also do have a verification and certification program that we run under the AHAM verified mark. If you go to the next slide. Now, AHAM is a standards development organization. We are very, very small compared to some of the others that have already talked today, as well as compared to an ASTM. We have 21 published standards, but we are ANSI accredited, and we live and follow the ANSI essential requirements all the time when we're developing standards, whether they're ANSI standards or not. So that's one of the things that we definitely believe in, is the consensus-based standard and the process that those essential requirements drive. For the safety standards, which mostly I think I'll be contributing with today, we submit proposals to both UL and CSA, depending on what product is supported by them. And we've done a lot of standard changes over the years, but specifically, if you want to look at a leading indicator, we track how many we submit each year, and we've submitted over 100 since 2012, roughly about one a month is the pace that we're on. Next slide, please. So with this effort, we call it special engineering. We've got a flow chart, everything that works with this to, again, make sure that we're driving a consensus standard. Prior to this process, we found that proposals would get submitted, but they'd get voted down. And we found that it was when we could get together and focus on the technical aspects and what went wrong, because we were starting our effort with things that maybe had driven a recall or a field incident, something like that. We do focus on those technical aspects. We've got engineers focusing on what they know. Over the years, we've now moved to what is coming new, whether that's connected appliances or other new technology that's entering the marketplace. But with this process, we really focus on having multiple paths for compliance. So you can have product requirements, but also we push to have a test out clause. So if you can pass this test, you don't have to meet the product requirement, which really helps drive innovation from an appliance standpoint. And then the other is we are not the experts of everything. So we reach out where we need to, whether that's suppliers. And an example on microwave two-step operation, we brought in the CPSC human factors experts to our process. So again, making sure we have the right people in there. So if we go to my last slide then, I just want to let you know, I'm like Tim. This is not malarkey. We've done good work and have an example of that here. CPSC just looked at dryers and fires over those products, and looking at where we submitted a proposal and that proposal became effective. You'll see that prior to that change, we were 2.5 incidents per year, and now we're down at 0.5 an incident per year. Again, this is a lagging indicator. We've already submitted additional proposals for dryers that we're waiting for things to show themselves in the latest data. But at this point, we really haven't been able to find anything other than lagging indicators. But Doug, I'll turn it back to you if there's any questions or any other comments.
Thanks, Randy. The second panelist this afternoon who was not present on the presentations earlier today is Don Huber. So Don, would you like to have a few opening remarks here?
Yes, thanks, and I'm very honored to be here and to participate in the discussion this afternoon. I tell you a little bit about myself. I have had a fairly long career, 40+ years in industry and consulting and even publishing. That's primarily focused on product safety and quality. I started with Kenner Products back in 1980. I was with that organization for about 20 years. Kenner actually became part of Hasbro at one point. After that, I went to work for Evenflo, baby products company. Was there for about 12 years, and then spent some time as a consultant with Deloitte. And then most recently, I was director of product safety for Consumer Reports. I'm now in business for myself and providing advice to clients around product safety and compliance. So what some of the things that I want to talk about today is using incident data to inform standards development process and improving those standards and to help prevent injuries and other incidents involving those things. And so there are different types of data, obviously customer service call center data, product safety claims data, and retail returns data. Next slide, please. We can leverage this information to, companies can leverage it to improve product designs. Standards development organizations, though, most importantly, can take all of this information and cause product designs to improve by strengthening the standards. So primarily, that's what I'd like to talk about today. Thanks.
All right, thank you, Don. And the last person on the panel this afternoon whose organization at least wasn't represented this morning is Chuck Johnson. Chuck?
Thanks very much. You can go to the next slide, please. I am the president and CEO of the International Safety Equipment Association, which is the trade association for safety equipment manufacturers, distributors, and testing laboratories. We are, in a nutshell, the voice of manufacturers of safety equipment, and we use that voice in several particular ways. We are a standards development organization, and I'll talk about that in a moment. But many of our other programs are built around the standards that are developed for our products. So, for instance, like many trade associations, we carry out a policy endeavor, an advocacy endeavor in Washington, D.C. and around the world. But much of that endeavor is built around our standards. And so we spend a good bit of time trying to make sure that performance standards for safety products are adopted by reference into regulation and so forth. And so this industry very often uses its voice to advance the cause of standardized safety equipment. Next slide. And so as a standards development organization, we really have two jobs. First, we are an ANSI accredited secretariat for ANSI, and we develop ANSI/ISEA standards for safety equipment, and those are performance standards. And then second, we are the voice of the industry into other SDO activities, including several people that you have heard from today, as well as some others. And so we try to provide a forum for manufacturers to come to consensus about other standards that are being developed that affect or that utilize our products. And that's one of the messages that I think I have for this endeavor today, is that as we look at measuring the impact of voluntary standards, it's first important to realize, to be careful about exactly what standards we're talking about, because it's a wide range. We've heard a few people reference this today. But so standards for testing methods and performance standards for products, for safety equipment, for instance, are a building block for safety management system standards and for regulation. And so measuring the impact of those, of course, can be reduced to measuring the mitigation of injury and illness, and should be. But beyond that sort of base goal, there are other ways to measure impact that may be wildly different. And so when we look at our efforts to develop standards, we view performance standards for safety equipment as a vital tool to be used in other forums for providing predictive performance safety equipment. And predictive performance is a building block for safety systems. And so without predictive performance, we see a huge decrease in adoption of safety equipment in the wild, but also a decreased adoption of safety equipment in regulation, and a decreased adoption of safety equipment by reference in safety management systems. A good example of this is right now ASSP, as Tim knows, is talking a lot and working a lot on heat stress. And we're taking part in many of those conversations. And much of the red line of that work is to provide, for instance, at a very base level, definitions for safety equipment that are referenced in the management system standard. And those definitions very often should be reduced to standardized equipment. Providing minimum performance standards for safety equipment, I believe, is a bedrock for the vocabulary of safety as we move forward. So then when we measure the impact of our products, of course, we want to reduce that to mitigation of injury and illness, but we also may measure uptake of safety equipment in regulation, or simply an increased number of workers protected. So next slide. We have a repertoire of standards that we have developed. I'd quickly like to point out that those standards are, of course, personal protective equipment, but also you can see here some off-the-body safety equipment, such as emergency eye wash and shower. And you can go to the next slide. And then again, you see several. You'll see many of the well-known standards here as you look through our repertoire. But I think you can go ahead and skip forward 2 slides. So recently, we undertook an effort to quantify our industry's impact, first as an industry. So what is our economic impact as an industry? And so we measured that as the jobs that we provide in the world. And this is work, many of you who are in trade associations will have seen this type of work. It's something that many industries undertake. What's unique about the process we undertook is that our leadership said that our economic impact as an industry was secondary to our impact in protection. And so we also undertook to measure the people who are protected by safety equipment in the US. And you'll see that there on this first slide, and the number of workers protected. And so that's a calculated number of the total number of employees in the US workforce who are protected by standardized safety equipment. Next slide. And so again, you can look at our economic impact as an industry, but much more importantly, next slide. We can now use this data, and we would be happy to partner as we move forward. I think this would be one important body of data that is new and novel as we look at the impact of voluntary standards. We now have granular data at the state and local level, and as well as the federal level in the US, both by broad sector. So for instance, manufacturing workers, medical workers, service workers, and so forth, and the number of people protected in this instance for Texas, but we can do any state, of course. We can also drill down much deeper than that into literally thousands of job types. Now, we only have a baseline data point at this time, but we plan to replicate this data year over year. And so we should be able to produce trend lines as new safety standards are promulgated or adopted into regulation or into safety standards to see how adoption of safety equipment changes over time as the environment changes. So I'll stop there. I wanted to highlight that important piece of data work that we carried out as sort of a contribution for the day. And I'll turn it back to you, Randy.
Thank you.
All right.
Yeah, no problem. Thank you very much for all those introductory comments as we've gotten started. Now, one of the things I would mention is that the way we are going to conduct this panel discussion is a little bit different than many panel discussions you may have heard in other places, and that is, where the facilitator, which is my role, kind of throws a softball question to one of the panelists, they answer it, and then I come back and lob another softball to someone else. Our intent for this conversation is really to have an open dialogue between the panelists about the topic of measuring the impact of voluntary standards. So in doing that, I'm going to do my best to start the conversation, but I do expect, and we'll allow our panelists to ask questions of each other, as well as challenge maybe some of the viewpoints that might be put forward. But really the idea is to build on what we heard this morning and take the first steps on how do we solve this problem of measuring the impact of voluntary standards. And maybe to start the conversation, the first thing I'd ask is, each in the conversations leading up to this, we've each understood that this is a difficult task that we're talking about, measuring the impact of standards. The CSA group talked about spending money with an outside consultant to help them go forward with their efforts. And from the UL perspective, we talked about the idea of getting started, but coming into some very severe roadblocks in what was going on here. So given that this is hard, why are we here? Why is it important to your organization to measure the impact of voluntary standards on health and safety?
I take a shot at that?
Go ahead, Doug. Yeah.
Yeah, thank you. First of all, thank you to ANSI and UL and the others for putting on this event. I think it's been fantastic so far, so really appreciate it. I mean, as my colleague Addie Iyer mentioned this morning during his presentation, there's a variety of reasons that we're trying to measure the impact of standards in a fairly quantitative way. And the importance of that project, I think, was reinforced by listening to some of those presentations. I mean, Casey, for example, talked about vulnerabilities in terms of where the data is coming from and how reliable it is. And even Chris from the EPA talked about the vagaries of data. So I think it reinforces what we're trying to do. I'd be interested in talking to Tim or having him perhaps comment on some of the things he mentioned this morning about leading and lagging indicators. I'm a big believer in those, by the way, but even they have to be measured so that we can have effective metrics. So I'd be interested to know from Tim how they plan to actually put the metrics to those leading and lagging indicators. And when we were off camera, Chuck mentioned that he was particularly interested in Addie's presentation this morning in terms of measuring impacts. And I can see from his presentation that he has a number of metrics on the board. And I'd also like to understand where those metrics come from. And I guess broadly, in listening to the discussion this morning, and I think one of the objectives coming out of this session is where do we go from here? And I think all of us, whether we represent SDOs or industry associations or government, we all have a vested interest in bringing and using standards that impact the lives of everyday people, whether they're consumers, whether they're manufacturers, whether they're hospital workers, whatever it happens to be. And so certainly from a CSA point of view, And given some of the work that the organizations represented on this panel, can bring forth, I think we would be more than happy to coordinate and work with those organizations to help advance how we view the impact of standards. We're all in this together. It's a complicated puppy. It's a hard one to get your arms around. So I think the more people that get involved, the better.
Thanks for that. And I can tell already that we're not going to have a problem filling up the hour plus that we have for this panel discussion, since practically the whole panel is ready to weigh in on this question. But Amanda, I think I saw your hand up first.
Thanks, David. So taking it down to kind of a micro level, AMI was founded as a standards developing organization. And we have a legacy now that's more than half a century long, supporting our stakeholders and our stakeholder community through bringing groups together to develop standards for the safe and effective use of health technology. So standards is very central to our mission. And in a very fundamental way, knowing the impact of and the depth of the impact of the standards that we support, whether it's a qualitative measure or quantitative measure, or just even perceptually, helps us to assess how well we're delivering on our mission and delivering what our members would expect of us. So how well we're meeting what they expect of AMI's role. And if we're not, what do we need to do to get there? And I suspect that other SCOs that are also membership associations might have a very similar view of that. So I'd be curious to hear from some of the others.
Thanks, Amanda. Tim, you have a comment too?
Yeah, I would say ASSP's been around for over 100 years. It's cut its teeth on safety. Number one question we get from ASSP members, OSPRO stakeholders, the standards that you develop, what difference do they make? What's the impact? Primarily too, because safety is so heavily regulated in a lot of areas. So if you got a federal standard for confined spaces, why do you need to have a consensus standard for confined spaces also? So we have to make that case. And I don't think there's anybody on the panel that doesn't face that issue. To the question that I had on leading indicators. So what we did is the committee was created. Now, leading indicators have been around a long time. So, it's not like that they've never existed. So what the committee did first is they did a really good literature search. We do have some researchers, some good solid academicians on there as well. That's what the first thing they did. They went back and they saw what had been done there. They looked at some of the work that had been done, not in standards perhaps, but in different types of study work and academician work. Then a consensus process took effect. So basically that's the methodology that they used. And then it's been through, obviously ballot and public review and all that good stuff. So it's getting ready to come out. It's a good solid document, and like any standard, it's got to be revised, withdrawn, and everything within 5 years or reaffirmed. So I really think this is just going to be the start. I don't know if I answered your question or spoke around it, but that was the methodology.
Thanks, Tim. The next hand I saw come up was Elise.
Thank you. Yeah, I echo everything that the rest of the panelists have said. And I think, from my perspective, one of the most important benefits is this kind of methodology can help inform decision-making. I know today we have several human health and safety agencies like FDA, CPSC, EPA. We're all charged with protecting human health and safety. That's a big mission, an important mission, and we need to use our resources wisely. So having data to help us make those decisions about where we're going to get involved, what we can expect, I think that would make a profound difference. And personally, my instinct is that with this data, you'd probably see a lot more participation than you even already see today. That's at least talking, but I think that's where this would lead us, and probably more participation, not just from your from government agencies, but also from consumer and environmental protection NGOs. I think this data would really help inform participation from those groups, which is really important to having a credible standard. Thanks.
Thanks, Elise. And Chuck, would you like to address that question?
Sure, and I will keep this short. First, ditto to what everyone else has said. I think that there is a suite of longstanding questions and evidence that our industry needs to drive the use of standards forward, if appropriate. I'd like to throw out a bit of a provocation, which is a new issue arising from the COVID pandemic. Our industry is looking at new tools and new pathways for communicating because of hesitance, skepticism, and disinformation. And we're actually engaging with the communications community about how to deal with specifically misinformation around safety equipment that has been introduced from the COVID pandemic. And we believe that this body of data and other work like this can help us combat what has become a sort of new, a very recent new environment and landscape for the use of these products. So it's a major concern for our industry, and it's a new thing. And I wonder if anyone else has seen that.
Thanks, Chuck. Casey, would you like to?
Yeah, absolutely. Thanks, David. Yeah, I ditto and agree with everything that has been said. Absolutely. I think it's important as a standards development organization to see how our work changes out in the real world. It's important to be part of a standards development organization and work to see how that's developed. And it can potentially be used in the world in different capacities. And as Doug stated, we're all in this together, and working together, we can work towards that mission. I feel like for impact, it's always important to ask ourselves, what's the real impact of our work? When we look to evaluate impact, we want to know for ourselves what works and what's not working. We want to persuade others about impact and the importance of what we're doing. And then ultimately, we want to manage more successfully better priorities and identify better programs and manage course correction if needed. And I think that's where our partnerships come in and working together.
Thanks. Randy?
Yeah, thanks, David. I guess I'm going to try to link a couple things that I've heard with kind of our philosophy here at AHAM. And I'll start off first with, we believe you get what you honor. And so with that honor, the first thing you need to understand is, well, if I'm going to honor something, I need to know what's good or bad, which leads you down to that metric. And then very similar to Amanda, looking at what's the mission with that from an appliance standpoint, we believe that the product should be as safe as it is functional. So you get with that. And then that kind of led us into what we wanted to measure. And again, kind of starting with those lagging metrics with that. So leave it at that. I'd say I'm thinking about Chuck's question on communication, so I'll come back to that.
Thanks, Randy. Don, you're a bit unique on this panel in that you're kind of our voice of the consumer. So yeah, we're interested to hear what you have to say here.
Sure. Thanks, David. Most of my experience has been in the consumer products industry with the time that I spent at Kenner and Hasbro, and then at Evenflow, and participated on the subcommittees essentially with ASTM International in those areas, and had the honor of being chair of two of them, handheld infant carriers and also stationary activity centers, and did those for many years. And it was very rewarding, and it was because there were products that were being produced by one of the companies that I worked for. I think the thing that where I think standards participation in standards development organizations is important, especially if you're in industry, you're working for a company that's producing a consumer product, is the fact that you're always on top of what's going on as the standards continue to be worked on and improved by the subcommittees. It is a way to easily stay current, so that you can affect the designs of your products in a positive way to make them better. I think that I've actually seen in across all of the different juvenile products and the toy standard itself, where people have been or where companies actually participating and understanding incident data and things like that has a great impact on the fact that they can go back and improve the designs of their products to make them more safe. And also so what it also does then is a huge savings in the long run of not having to deal with incidents that are associated with children or any of your consumers being injured by a product. So I'm a true believer in the process and have seen it work and used it in developing our internal standards when I was in industry, and usually going about 15% above whatever the requirement was in the standard as our design target, and found it to be a very instrumental in lowering our cost of incidents that are happening in the field.
Great, thanks, Don. And Doug, you have a follow-up you'd like to talk through?
Yeah, I'd like to pick up perhaps on what Chuck was saying and maybe ask for some more information. I'm aware of disinformation around the pandemic from a political point of view, but with respect to disinformation about safety equipment and standards, I just wonder, Chuck, if you could maybe expand upon that a bit.
At our annual business meeting later this month, we're bringing in a speaker to discuss disinformation that's deliberately promulgated during the political cycle. We have some specific examples from our industry that may be in those camps. Some of the information that was circulated during the pandemic about oxygen deprivation during the use of face masks, and some other information along those lines is what we're looking at specifically. Also, there have been a few measurements of personal protective use, and whether or not polarization of that particular subject led to decreased utilization of barrier face coverings and respirators. And then finally, there's some specific discussion happening around the medical community and the polarization of the subject in the medical community, leading to the loss of employment. And so all of those things are issues that our industry is worried about. We feel that we are on our back foot when it comes to positioning ourselves to address some of those issues. And we want to make sure that good decisions are made as we move forward as an industry. I would speak specifically to some research done in the communications field, which shows that responding to some of its fear-based disinformation with data and facts can re-entrench skeptics. And so different communications strategies have to be pursued in order to combat this type of work. And so we are looking at any and all, we're at the beginning stages of this work, but we feel like the industry needs to be prepared for what comes next, because we do feel like there is a new normal out there for this equipment.
Thanks, Chuck. Tim?
You know, I would just say an example I thought of is, so ASSP, we have the Z9 ventilation standards. So we write those. And I did see a lot of misinformation during the COVID-19, which is still ongoing. It's still an ongoing crisis. The stuff that I saw more was misreporting of the impact of industrial ventilation on work sites, how many cubic feet per minute has to move, that type of thing. Evaluations of facilities was a thing that I saw with ventilation. So that would be, I thought when Chuck was talking, that was an example that I saw that I did see. Actually, it was fairly common. I saw it in a lot of sources too, mainstream stuff, obviously a lot of trade publications and things like that, but it did happen. Back to you, David.
Yeah, thanks. You know, and one of the things that this kind of touches on is the idea of, well, how are we going to use this information about the impact of our voluntary standards? What is the ultimate goal, if you will, of doing that? And you know, Chuck, you just brought up the idea that maybe just throwing the facts that, you know, we've reduced the injury rate by X% may not have the intended effect. So what are some of the ways that you see that we can use this impact information in a positive way? How would your organization go about using the results of these kinds of impact studies? Chuck?
So I heard that directed at me, so I guess I get to go first.
Yeah.
Several different ways, but actually I'd like to start, David, with how we won't use it. And I think you just said it. We can't just post this. The days are over when you can post a 30-page white paper to your website and expect pretty much anybody to read it. Now, first of all, there are professionals and true believers in the safety industry who are absolutely swayed by good science and in-depth reporting of that science. But that is one audience, and there are many more audiences now. And so one way we can't use this data is to just post it and expect our work to be done. But for instance, I showed you some of the data that we're producing as an industry, and we're using those numbers in narrative and storytelling. And I know that sounds, for a science-based group, and my entire industry is a science-based group, that sounds really lightweight, but it can be very persuasive. And so bolstering narratives and bolstering qualitative description of what you're trying to communicate with data is the way that we can use that. There will always be a place for you to go to an informed community and inform them further, but we have to take these tools and figure out how to reach out to less informed communities and now skeptic communities who are being inundated with information.
Thanks, Chuck. Randy?
Yeah, so I guess this is kind of a new area for me, Chuck. So I just like to dig a little bit deeper. I guess as you're looking at these conflicting groups, is there anything in common, that you can, say, try to focus on that as a metric, or is it just so diametrically opposed that there's no common ground?
I am by no means an expert, and I certainly don't want to co-opt this discussion with this one discussion item. Randy, the common denominator that we are being told about is that a lot of at least deliberate disinformation and some organic misinformation that is available in the public is driven by fear and fear reactions. And so the very quick analogy that we were given to start thinking about this is the jaguar in the grass. And you're on the savannah and the observer sees the grass move. And if you are afraid of the moving grass, you have two choices. You can assume that it's the wind, or you can assume that it's the jaguar. And if you assume that it's the jaguar and you run away, you may live another day. And if you were wrong, you're still alive. But if you assume that it was the wind in the grass and you were wrong, you're not. And so that is a blunt analogy that is used for much of the fear-based disinformation that is introduced onto the internet. And it's certainly true for oxygen deprivation for respiratory protection. You could be wrong and not wearing it, and then you are exposed to possibly a pathogen, or you could be right and you are not having oxygen deprivation. So how do we combat that? Look, I can give you examples of what we're being told about and what we're trying to learn more about as an industry, but it's early days for this. And so I think on that note, we have to engage with a community of communicators who have been dealing with this for quite some time. The GMO industry is an industry that's had to deal with this for quite some time, and we're learning a lot from them.
Thanks. Amanda, do you have a comment?
Yeah, I'd say to Chuck's point that it's not enough to just post a document. I'd say some of the impact data might point to ways that we might improve, or areas for improvement in the standards themselves, but it might also suggest that there's other ways or more work to be done to operationalize the standards and make them more digestible and more usable. So things like derivative tools and calculators based on the standards, or even educational resources that help people to, really fully understand this is what they're used for, this is how you implement them.
Great point, Amanda. I think the idea of, it's not just a standard, but maybe a standard solution that surrounds the standard with other, products, other deliverables, would be a good way to use some of this information. So thank you for that. Doug? Doug, you're on mute.
I knew that would happen. Thanks, David. Yeah, my role in CSA is government relations. So our task is really to connect what we're doing in terms of standards development or research or education with the needs of government. So to the point about this question about how we plan to use it, how we plan to use more data, as Addie pointed out this morning, we certainly want to use it to make sure our standards are being utilized and that they're effective. And if they're not, we need to update them. There may be new areas that we need to be exploring, and hopefully that information will help determine those directions. But one of the things we are trying to do is to, from a government relations perspective, is tie what we do to key public policy initiatives. And one of the ways we can help do that, somebody mentioned telling a story earlier. I think that's what we have to do better, is not just go in and talk about it on a transactional basis about individual standards, but go in and say, look, these are the major public policy initiatives that you're trying to achieve. Here's how standards, here's how education, here's how research can support your public policy objectives. We're talking, for example, to our local government here in Ontario, who want to double, if not triple, the number of reference standards in regulation in order to reduce red tape, for example. But they also have challenged us to say, if we're going to use your standards, how will they impact the public policy objective? How will they impact ordinary Ontarians? And so that's a challenge that we have, and it's another motivation, frankly, for the exercise that we're going through.
Great, thanks. Elise?
Yeah, I agree with what Doug just said, and I'll say, I work in an agency where probably it's full of people that would read the 30-page review document, but also take the point that executive level communication is also really important, and storytelling. And I think, if I could create the perfect scenario here, it would be a voluntary consensus standard for measuring the impact of voluntary consensus standards, which is very meta. But that, I think, would make it easier for, federal agencies to use the outputs of this discussion. And then case studies, stories that are, like Chuck said, that have that credible data as part of them, but that are snippets telling a quick, short, interesting story about how this can benefit public health and safety.
Yeah, the thing is, we've been talking here about the idea that, data works with some people, stories work with another. It just comes back to, I think, something we all learned early on in our careers. And that's, if you want someone to get a particular message, you need to tell it 7 different times in 7 different ways. And I think that's one of the things that's coming out in this discussion. Don, would you like to say something?
Yeah, talk a little bit about regulatory agencies, and the one I'm going to talk about obviously is the one that I've dealt with primarily over time, and that's the Consumer Product Safety Commission. And the importance, first of all, of the CPSC being part of the standard development process. For me, is primarily through ASTM, and having their input because of the depths to which they go and assessing incidents that are occurring in the field. That data is very important for the subcommittees or committees to have within SDOs in order to strengthen the standards and make products more safe for the folks out there who are using those products. And another way that the CPSC is important, and I would say that this could be good for whatever industry you're in, using the regulatory organization that for that particular industry is to develop a working relationship with them. When during my time, mostly at Evenflow, because it's juvenile products and people tend to be a lot more focused on safety of baby products, obviously. And so what we did, we went out of our way to develop a relationship with each of the commissioners as well as the staff at CPSC. And that was very important for us, and we learned a lot from them. We could adjust our own internal standards based on that discussion, and found it to be very, very helpful for us.
Thanks. Tim?
I think that Don just made a really good point, and somewhere that, the point of this event today is measuring the value of safety and health. And I'm thinking of working with government, which for us has been extremely beneficial. So on our committees, OSHA, NIOSH, part of the Center for Disease Control, has been very, very contributory to our programs and our standards. And we rely on them for a lot of the data that proves the value for what we're trying to do. A lot of the testing methodologies, the fall protection testing came from Air Force tests many, many years ago that were done there. So that's what a lot of that is based on. I think a great example, though, is the U.S. Army Corps of Engineers, the EM 385 manual for construction and demolition safety. When that is put together, they do an awful lot of work with all the safety organizations and standards developing organizations. And basically, you have to prove your case and all that. But that's a solid document which is used not just on Army Corps projects, but it's referenced all over the United States. So I think that's a really good example of how the public and private sector can work together on the measurement of value.
Thanks, Tim. Let me transition a little bit. We've been talking about the impact of standards on health and safety, and that's a big topic. In that, there are lots of different standards. Chuck talked about, some of the different types of standards that we've already heard about this morning, and then we have the somewhat different spectrum of health and health impacts versus safety and safety impacts. What are your thoughts on how we scope this problem in order to have an ability to make progress against it? Because if we, take a look at, health and safety across the broad spectrum of standards, we might get stuck early on. So what are your thoughts on the scope of this problem and how we define it? All right, Doug. Thanks for jumping in.
Put my hand up because nobody else did. Just trying to help you out, David. No, I mean, I'll just make a very quick comment. As Addie pointed out this morning, again, we're focusing on this initial stage of our exercise on gas standards and healthcare. And, in looking at some of the preliminary information that we've received from the consulting company that we're working with, to your point, this is a complicated puppy, as I've said before. There are lots of URLs that have to be checked to make sure that you're cross-referencing, to make sure that we're gathering the right information and that information isn't necessarily out of date. So in terms of the healthcare sector, certainly we'll have a better idea of where our standards are being utilized in the healthcare sector after this exercise, and what some of the challenges might be in extracting and dealing with that information. To your point, if you look at occupational health and safety, that's another complicated subset of standards. And as Addie mentioned this morning, we'll probably be looking at other areas of standards once we have a model that works for gas and healthcare. But I think you're right. I think the magnitude of both health and occupational health and safety are very significant, and it'll be interesting. I'm interested to see, from our consultant, just how difficult or challenging or easy it is to extract some of this information. We just don't know yet, but it is going to be complicated.
Thanks. Randy?
Thanks, David. So my first comment was going to be, it depends. Which one, health or safety? And I really think it's going to come down to the individual association, manufacturer, group, whatever it is that matters to them. Is it health or safety? Obviously from our standpoint, we start where the recalls happen. So it's safety, but now we're into indoor air quality and health aspects. So I guess that the other thing I'll just leave with is it's all about continuous improvement. You don't get perfection by shooting for perfection. You get perfection by improving every day. And again, set the metric. When you've driven that metric to the best it can be, then you go to your next item, whether you can switch from safety to health then, and then again, continually work that metric for improvement.
Thanks. Tim, I think you're up next.
This is another great question because it really hits once again to the whole theme of what the event's about. So I would argue that when we look at health, then you got to look at the public health model, our epidemiological experts, and I know they know far more than I do. And so if we're talking about health, it's measured in a different way. You have latent effects and indirect and all that. If you're talking safety, a lot of times it's direct. A fall from heights is a fall from heights, and it's an immediate type thing. So this is how I see it. So if we're talking about measuring value, which is where I'm kind of drawing this to, this is a really good question because I would argue in some ways we have two different models that are working against, I wouldn't say against each other, but maybe not quite as synergized as they would. So I would think that our epidemiology people would be a really good source for information on this one because to me, it's a different methodology and different results.
Thanks, Tim. Casey?
Yeah, so in our case study approach, as we mentioned earlier this morning, we really focused on the principles that safety is dealing with acute injuries and health is focusing on measuring the chronic, right? So the impact of public safety can be a direct contribution of health. And when you look at health, you're looking at the big spectrum, which includes injury and prevention and safety, which is part of UL's mission.
Thanks. Elise?
Thanks. Yeah, building on what Tim said, I think there are a lot of definitions for health. And my colleague Chris pointed out there's a WHO definition that is a state of complete physical, mental, and social well-being, and I want that definition for myself. But that's incredibly broad, and there are others that we use or cite. But I think it might be useful to kind of find out what resources we have that can help with this, and then work around an existing framework. So Tim mentioned epidemiology. I think another kind of source of expertise, at least within the government, is risk assessment, where we kind of proactively look at what risks might be expected to human health. But I guess that sounds like a lazy approach, but building on stuff that already exists and kind of building our definition, at least initially, around that might be a way to not burn ourselves out and make some progress in the near term.
Yeah, thanks, Elise. As one of the outcomes we hope for today is to build a coalition of the willing to address this problem. So I think your point about you have to work with the team that you've got, and maybe that will help us scope the problem. So thank you for that feedback. Don?
Yeah, David, thank you. I have a question that's kind of for the whole panel, and it has to do with organizations that are not governmental organizations or SDOs, but organizations such as the International Consumer Product Health and Safety Organization, otherwise known as ICPHSO. And I would love to hear more about organizations like that, because ICPHSO has a big impact on consumer products companies and learning from each other to develop stronger safety programs within their companies, and sharing of information, and find it to be very beneficial in that area. I had the honor of serving on the board of directors of ICPHSO for a while, and truly believe in that organization. But I'd like to hear about some from the rest of you about organizations similar to that.
Thanks. I'm sure I'll give the rest of the panel a couple minutes to think about that one, because I think, Amanda, you might have had a comment on our previous topic of scoping, or?
Yeah, I did. I was going to say that I think both the definition of health and safety are evolving, and I think Elise mentioned that. I think in the medical device field, traditionally, safety related to the patient or to the operator. But I think now with interoperability issues for medical devices, safety also applies to systems and to networks if you've got connected devices. So it's not just the risk of adverse events to the individual patient, but also to an entire network. And I would also add that safety is evolving to also refer to different ways of delivering care. So for example, with remote control enabled devices to more safely deliver care, so you're stepped back from patient care. And maybe though, part of it is an issue of whether we need to define impact so we have a better basis for comparison.
Yeah, definitely. I think someone else had mentioned earlier on the efforts around, making definitions as part of the standard setting process. And I think that's a great point, Amanda, that what is impact? We need to make sure that we have a common understanding of that. Yeah, thank you. Chuck, comment?
Yeah, I'd like to pick up on the question and the comment that Don threw out about, other organizations that may be active in this space. And we would just note that we operate within a broad environment for safety, or an ecosystem for safety. And, you can bucket it many, many different ways. Very often we bucket it as the standards community, the producing or professional community, and then the end users, who are sometimes the employers and sometimes the wearers or users. But that's just one way to do it. You could do it 1,000 different ways. But what I would note is that for this particular project, and Don, to your point, we can slow ourselves down and work for a decade just trying to organize the entire ecosystem around these questions. And so maybe that's not, full inclusivity may not be the goal. However, reaching out to some of those groups to ask what questions they would like incorporated here might be very useful. And I can give at least one example. When we are contacted by user groups about safety equipment standards, the question is not, did the standard work? It's about conformity assessment, and it's about product differentiation. And so it's a completely different frame to look at the effect of the standard than we here within this group are talking about whether the standard, I think, impacts injury and illness, or maybe I would argue a couple of other metrics, but the end user may be less interested in that and may be interested in another basket of questions. And I don't know how much we should care. I imagine we should care some. So Don, that's to your question, yes, there's a broad universe of groups out there. We work with many of them. ACGIH would have a completely different view, I think, here, some of this. And we actually run afoul of that in some standards development organizations. For instance, chasing the standard effectiveness and regressing through zero is something that the industry worries about, because you can drive up cost and drive down implementation instead of reaching a broad audience. But some communities in standards development are chasing those nth degree impacts, and which is not wrong. But so, sorry, I'm just complicating that hugely. I guess I'll stop there. Yes, they're out there. Yes, we should ask them some questions. I'm not sure that those answers should be central to the endeavor.
Hey, Chuck, you threw out an acronym there. I think I got it as ACGIH. Could you share what that is?
I'm sorry, the American Conference of Government Industrial Hygienists.
Thank you.
Sorry.
All right, Tim.
I just wanted to comment on that one also. So the standards we write primarily are process-based standards. So how do you enter a confined space? How do you, test a copper tube piping on a construction demolition site? We don't write too many what I would call product-based standards. Some of our fall protection stuff might be into there, but our stuff is generally not sold. It's not sold to the end user like that. It's generally sold to companies that use on sites. But of interest, I would say the one thing is, for example, our A10 committee, a third of that is made up of labor unions. So, and that's very active. Our labor unions, they chair most of our subgroups. So should we do more, I think, with consumer product groups? We should. I think the biggest issue with a lot of consumer products is they ask us, ASSP, do you manufacture products? Well, no, we're telling you out on a confined space, and they don't have a lot of interest. They did have interest in our 45001 standard for the global management safety standard because of the sustainability and the chain and all that good stuff. But no question, we should do some more outreach.
Thanks. Elise, I'm going to ask you to kind of close us out on this topic, and then I'm going to move us forward. But go ahead, Elise.
Sounds good. So Don, I really think ICSO is special in its nature, and I think you should be proud for being having been on the board. And I really like the idea of maybe consulting international organizations early on, both with the goal of getting some, aligning views or seeing where our views might not be aligned, but also with the goal of identifying other resources to help us that we may not have thought of. I agree with Chuck that trying to make this a global initiative or loop them in and make them part of this is probably unmanageable, but that early consultation is probably definitely the juice would be worth the squeeze. And, I think in our space, we don't have anything like ICSO, but the WHO, UN Environmental Program, OECD would be some good groups to consult. And I think we could help with linkages to the extent that's helpful.
Yeah, and to maybe just to kind of wrap this part of the conversation a little bit is, as we move forward from here, one of the things that we'll definitely want to do is to talk about who's not at the table now that needs to be going forward. And, so Don, I thank you for bringing that forward, because, some of those other organizations may be critical to us making progress in this area, and they may not be represented in the panel or in our audience today. So we need to continue to ask that question. So I appreciate that. So kind of moving to another topic, we started the day talking about data and some of the challenges and some of the limitations of the data. Let me ask the panel, what data would you like to use but you don't have access to? And Casey, I know you answered this at the beginning of the or during your panel or your presentation, but maybe you could just kind of lead us off with your answer to that question from this morning, and then others can weigh in after that.
Yeah, absolutely. I can reiterate a little bit from this morning and go in a little bit more detail, but we would love to know more about the number of products out there on the market so that we can measure the incidents rather than the raw counts of data. So if we can get associations on board and manufacturers, that would really help tremendously to measure the accurate impact of our published content. And so that's what our focus would be on, would be number one, partnerships with individuals on this panel and any associations that we need to get plugged into, but then also those trade associations and those manufacturers to be able to get that accurate incident data.
Thanks. Are there others that have ideas on data that in your wildest dreams you'd like to use but don't know how to get to yet? Chuck?
There's a broad set of data that you can cut several ways, but it amounts to the delta between incidents before and after standardized equipment has been adopted. And so there's several ways to cut that. And there is there's some Bureau of Labor and Statistics data in the US and some Department of Labor data about the adoption of new safety standards, or safety regulations and the decrease, but it's pretty haphazard stuff. And I would say we have a good partnership with OSHA in the US, and even when we talk to them, they admit that a lot of this needs to be updated. And I'm looking at Tim because I think he's run into the same problems we had in terms of getting new and up-to-date data about pre and post regulation. I think you could broaden that question to pre and post promulgation of broadly used standards, management system standards. And so we're looking at many of those and would like to see that data.
Thanks. Doug?
Yeah, just a quick comment that, the project we're looking at right now in terms of where our standards are being utilized, as we've looked at those issues in the past, you can cumbersomely look at government regulations from one province to another, and something that would take a career to figure out. The consultant we're using is using AI technology in order to scan some of these resources. So, and that's above my pay grade to explain how that works, but we are using new tools in order to extract that information. So we're going to be very interested to see how much information we do get, how many questions it may raise in turn, but we are relying on new technologies to extract that information. Right now, in some cases, we don't know the data we don't know. So this is going to help us with that exercise.
Thanks. Thanks. Randy?
Yeah, I guess I'll kind of ditto both Chuck and Doug there. Really the need to understand what's changed after you've implemented a standard or a change to the standard. So being able to pick that up, and again, you're dealing with lagging data. So being able to come up and model that, but be confident in the correlation of the modeling. I know there's efforts going on with, since we're a consumer product, looking at ratings like from an Amazon. So you can, a lot of initial things show up in somebody's comment in some product they bought. And so it's very easy to, I'll say, maybe work from there. Maybe the easy is not the right word, but you got to mine the data, find that and then get them correlated and then look at the kind of the differences there. But I think there's a whole opportunity here of better data rather than the standard. Again, I love the NIST database. I love what CPSC has put in place, but a lot of that is just, it takes too long to get to the information.
Thanks. Chuck, we had a question come in from the audience that was specific about data and measurement there, and it was how do you measure the number of workers protected? I think that was one of the statistics you had in your slides. So, Chuck, how did you go about getting that data?
It's a lot of work. So there's a complex methodology here, and I won't get into a lot of detail, but the consultant that we used for the foundation of that work is a group called Dunhill and Associates, and their established methodology is a Department of Labor methodology that takes employment data across the country at a very granular level, and that's been produced by the Department of Labor. And then through an exhaustive process, they can go through that data and identify. They can do two things with it. They can describe your industry for you by peeling out your industry from the data, which is a intensive process. But what we had them do was we took that employment data, and then our own membership went through the employment data set, which is something like 3,700 job types. And we identified the job types that use personal protective equipment, and we identified the types of personal protective equipment that are used as a matter of regulation, like what is required. And so it's not exhaustive. The work that we did doesn't capture, for instance, any work that is done that is for which the PPE is provided through retail sources. I'm sorry, we do capture some of that. So it's a great start. It's a beginning of the work, but it was essentially an exhaustive identification process that went through the BLS data and identified those job types and then counts them and then differentiates them. As you can imagine, there were hundreds of issues with double counting and there are limitations to the data set in that regard that we have to be careful of. But our intention was to make sure that whatever we did was defensible, and that's why we used a third-party group that is broadly recognized to do quality work for the Department of Labor. And we think that the project has produced a very defensible set of data that describes the use of the products.
Thanks, Chuck. Another question that came in regarding data and data sources was, essentially, what are maybe some international sources of data, other governments outside the U.S. Or other sources that we might, again, broaden our horizon and look across the globe, because it is a global marketplace and standards do affect people around the world. So thoughts on international data sources, Tim?
A couple of things I saw. One ISO. When an ISO standard is developed and they have to put together a proposal for it. So when 45001 was proposed, the British Standards Institute, who proposed that standard, they did, I thought, a masterful job of compiling all the data, information, and background that justified the creation of that standard. So I would say, and I know it's probably fragmented, but the ISO proposals for new standards, I think, are pretty extensive and there's good, solid information. The International Labor Organization has some very good data that I've seen also, which I think helps. And you have to dig. The United Nations, for example, has some data also. It's tough to find. We have consultative status with them, so we can see some of their things as well. But I would say if you're looking for good occupational safety and health data, take a good look at the International Labor Organization and some of the ISO stuff, which I think is pretty solid.
Thanks, Tim. Randy, you have a comment?
Yeah, I had a similar experience as what Tim has on the consumer side. We have IEC, which is internationally is the safety standard. And so a lot of different countries are bringing in information while we're working on improvement to the international safety standards. So whether that's RAPEX out of Europe, London Fire Brigade comes in with a lot of information, Australia. So connecting those dots around the world is kind of the first task, but there's a lot of common information. And in some cases, in an appliance world, a product may have been launched in Asia before it was launched in the US. And so their data is ahead of ours, even though it's still lagging data. So it is important to look at that and connect with those sources.
Great. Thanks, Randy. we have been talking about the outcome data a bit here, and incident data and recalls and some of those kind of things. But we also heard from Tim about the idea of leading indicators, and Doug and Addie from CSA Group talked about the idea of understanding where their standards are used and referenced and adopted, if you will. What are some other leading indicators or progress markers that we might want to consider in looking at maybe not the final impact, but are we on the right track to impact? What are your thoughts about things we can measure along the journey to impact? Doug, you want to start us off there?
Yeah, just from a fairly current issue. I mean, Chuck mentioned earlier about the pandemic, and we're very much involved in looking here in Ontario and right across the country, actually, at the long-term care sector, for example, where there's significant issues around PPE, significant issues around infection prevention and control. And, so we're going to be as well looking at what can we, I mean, I guess if you look at infection prevention and control, the lagging indicator would be, are we improving the situation? Are we reducing infections, et cetera, et cetera? But I think some of the leading indicators could be how many people at, let's say, a long-term care facility have been trained on infection prevention control, what systems have been introduced to deal with infection. And some of those elements will lead you to the end result in terms of the lagging indicator. So depending on the topic that we're dealing with, you can, as I said earlier, that's why I'm a big believer in leading and lagging indicators, because if you wait till the end, it's too late. So you have to be measuring step by step to make sure you're making progress. But that largely depends, of course, on the topic you're dealing with.
Thanks. Elise?
Yeah, I think there's two things that regulatory agencies do that could be helpful. The first is benefit cost analysis. So in general, when any agency produces a regulation, there's a benefit cost analysis that goes with that, right, when we put that regulation out. So there's a methodology for doing that. It's done by many agencies across the federal government. You guys heard from my colleague who's one of our economists who works on that. We've got a lot of smart people in EPA and other agencies that are kind of trying to project out how that regulation will impact things. And the other is risk assessment. So, in our world, we run risk assessment on substances. We look at the research of possible impacts, the likelihood of impact. So there's a lot of, I'd say, disciplined approach in that world. And it's not just an EPA thing, that's across the federal government, and I would assume across other countries' governments as well. And I think those two disciplines could help inform kind of, when you publish the standard, what is the intended impact of this, as opposed to looking at what actually happened at the end of the day.
Yeah, Elise, it sounds like that benefit cost analysis might identify some of the key milestones along the way to achieving those benefits. And so there may not be a single answer, but as you look individually at a standard, at a regulation, mining that information is kind of what I hear you say. Is that right?
Yeah, that's right. And I think also, both the benefit cost analysis as well as the risk assessment tends to be publicly available. It tends to be things where the public can provide comments. So there's a degree of, a lot of input towards this, not just our smart people, but, members of the public and others kind of making sure that information is good.
Great. Thank you. Don?
Yeah, thanks, David. One of the most valuable sources of information for a consumer products company, and even for consumer product standards development organizations, is listening to the consumers who have had issues with the products, the complaints, especially when they're calling into the call center and they've had an issue with the product and someone's gotten hurt, or they have even other complaints that are maybe more around quality that can even provide some additional information. So that kind of data directly from consumers is really important, and I think that for standards development organizations, finding a way to get more of that kind of data, not just data from the governing regulatory body, but directly from consumers, I think would be critical and really helpful.
Yeah, thanks, Don. That reminds me, and I don't remember whether Casey called it out or not, but the saferproducts.gov website, takes some of that feedback directly from consumers, and that data set is publicly available, so that might be a place. And then the other thing, voice of consumer these days, everybody is able to review any product online. And when we talk, Doug talked about big data and artificial intelligence, mining some of those sites for product reviews to get that kind of data that you're talking about, Don, might be a useful approach. Chuck, did you have a comment as well?
Yes, to your original question about what leading indicators we could use. We have a host of them. So first, trust, which for our products is trust that you are being protected. And does the standard affect that? Adoption, and this did the standard affect the widespread use of the safety intervention or product? Compliance and education, is the product being used more effectively or properly? Behavior in general, has the safety culture improved through the standardization of the product? Differentiation, did the standard lead to consumer choices across a spectrum of quality? And I think that's more important outside of our area for consumer products. That may be something to look at. And then as a separate item, employer adoption. And this is not just in the use of the safety product, but also in safety in general. So those are all metrics that we have looked at, are all items that we have looked at to measure over time. And no one ever has enough money or time to do them all. So
yeah, time and money. Anything can be solved with enough time and money, but yeah, those are scarce commodities. Tim, you have some comments there?
Yeah, I think I would say, first of all, IBID to what Chuck Johnson just said. Great minds must think alike, because I was thinking the same exact thing. And I did want to tie into what Don Huber said. So we did a webinar the other day with a sponsor, drew 750 people, and it was on risk assessment. So I'm going with what Elise said. And of interest is there was a big issue, and one of the big questions was, how do you tie leading indicators, specifically survey data that you use for occupational safety and health, and use that then as far as with your remediation and your ongoing improvements? So I just want to say it was a specific example that I just saw in the last 48 hours of how risk assessment is used. And another good example I thought on that one as well is we use a lagging and a leading indicator. You're buying a power press is a specific question I got in the last 48 hours. So you're installing a power press. It's from a European country. You're going to put that in there. What's the first thing you're going to do besides looking at the directions and all that? You're going to look at any incident or history on the thing as far as installation and use. And then what you're going to do is you're going to tailor your engineering and your safety programs to address that. So in effect, you're going to use a lagging indicator now in a leading application. So that was just something that I thought of when we were talking about all this.
All right, thank you. And Amanda?
Yeah, to the point raised earlier that leading indicators can become lagging indicators if left unaddressed. There have been times where we've had process-related standards, and shortly after the standard has been published, even as a first edition, we brought the group back together and looked at what new has happened, or what else needs to be considered in the time since that standard has been released. So are there reports of adverse events that we need to mine for additional data? Are there news reports? What's the impact been on public perception and patient confidence? Is there any new guidance that's come out from regulatory agencies or government agencies? What new research has been issued? What changes have happened in the technology? What changes have happened in the profession? In some cases, we've had compulsory certifications come down the line, and those need to be taken into consideration. So there have been times where we have decided not to wait for that usual 5-year review cycle, but to move much sooner, to incorporate the changes in the landscape that have happened, so that we don't get to the point where a standard is obsolete or it's not serving the group that it's intended to serve.
Right. Thank you. We've got only about 10 minutes left in the panel discussion. And I can see that my early fear about how are we going to fill up an hour and 45 minutes were completely unfounded, because there's lots of questions that I had prepared that I don't think we're going to have time for. So let's transition to, again, the goal of this workshop today was really to get people interested in the topic, identify this coalition of the willing to help us solve this problem. So let me ask you, what are some of the first steps after this meeting that you think we need to take in order to make progress on this topic? So what would you like to see happen in the next week, month, and maybe 6 months coming out of this meeting? Elise?
I'll take a stab. I think this meeting has really opened my eyes to how much is out there. And I'll say this kind of measuring the impact, specifically for EPA, of our use and participation standards, that's been a bucket list topic that I've wished and hoped we could get to at some point before I retire. So this is really exciting, but I think the first step is really taking stock of what's already out there, what resources, what methodologies exist. My eyes are open that there's a lot more than we thought, which is great news, and running a gap analysis to figure out, where we might be missing some stuff and what are the gaps that we need to fill in where something doesn't exist. And I think that would really clearly inform next steps.
Thank you. Yeah, Doug?
Yeah, I agree with Elise. This has been an excellent day and an excellent event. I must admit, as much as I've enjoyed it and learned a lot, my head hurts because, this is a complicated, broad subject. And to Elisa's point, I think we need to somehow, and I don't know how, but narrow this down to what are the key components we're really trying to address. I just feel like we take a shotgun approach. We may hit a lot of things, but not deal with anything effectively. So somehow we have to narrow down to what's important here from a safety and a health perspective. What can we reasonably tackle, and then figure out how to do it. So that's my only concern at this point, David.
Okay, thank you. Casey, do you have some thoughts?
Yeah, thanks, David. Yeah, I agree with Elise and also Doug. And I think here at UL, we have some good ideas for our case study approach, and we're looking forward to filling in those details and hoping that it pans out going forward. And I think we hit on it earlier about partnerships and learning best practices. And no matter what additional outcome data we can get, we need to move away from solely just measuring the outcomes and also expanding our portfolio. So we need to know more about the process and what happens before manufacturers are producing the products in conformance with the standards. So I think that's really important too.
Thank you. Tim?
I would say after going through today, I've realized that what I don't know could fill libraries. And I mean that from the perspective that, Chuck Johnson kind of has an idea what we're doing, and we know what Chuck Johnson's doing because we work with each other all the time. But I heard stuff today that I had no idea was going on, especially in those panel discussions, and some really good solid information. So if it's one thing I hope that comes out of all this is that we figure out a way to open up the channels of communication. So we're talking to other organizations that are doing, I think, some really cool stuff as far as showing the value of the programs.
Thanks. Don, what do you think we should do next?
My thought is that we need to do this more often. Maybe annually or even more often than that, and get more people involved and people who are joining in to listen to what we have to say and what other experts have to say. And I thought the program was excellent for the whole day. And the more we can share this kind of information, I think it's going to be hugely helpful to industry and to safety in factories and everything else. So
great, thank you. Randy, what are your thoughts?
I was, I guess, thinking that my problems are not other people's problems, that and what I'm going to have to do to fix mine is probably different. But going back to what Don said, it was really good to have this discussion because what Chuck and Tim are doing are quite different than my product specific standards, yet there's still things that I learned from that, how they look at things. So, maybe this is, if there's ICFSO for consumer products, maybe this panel can kind of become that for knowledge sharing across different industries and how to look at standards and drive improvements. But I guess that again is kind of my thought is each one of us probably has a different plan, but it's all been a really good discussion, and I thank everybody for their thoughts.
Thanks, Randy. Chuck?
David, I would say I don't know if or who is playing secretary for the day's meeting or rapporteur or however we define that. There were a lot of great ideas. What we would like to see, I think, is first, if somebody distills this into a bit of a discussion or a report out and identifies if there were any common questions across all of the participants, our organization would be interested in a further discussion about how to address any question that came out of this process. And not necessarily, certainly if someone wants to propose a project that solves all of our problems, that would be ideal. But short of that, there may be a question that we could pick up as a group. Our organization, I don't think that I didn't hear a piece of this where we feel like we would take the lead, but I've heard several places where we would certainly participate if a further project comes out of this. And we'd love to see if there's a person who can distill it onto a page, what arises. That's where we would be.
Yeah, thanks, Chuck, and thanks for asking the question about what else is going to come out of this, because we are recording this. We've got a transcription service running in the background, and the team that put this together from Underwriters Laboratories, CPSC, and ANSI are going to use that recording to produce, meeting notes and a report out on this. And for those who might not have heard, this has been recorded and will be posted after the event. So you can go back and pick up on those nuggets that you might have heard during the day today. I do have one other specific question from the audience, and that is, how can we use this utilization and impact data to improve the quality of our consensus standards? So kind of flipping, if you will, the topic here from, how do we measure the impact? Well, then how do we use that impact data to close the loop, if you will? Chuck?
I'll be happy to start there because that's how we use what bigger data is out there already. First of all, for utilization, there are so many standards, some of them good standards, that lie fallow after they are produced. And the question becomes why. Now, certainly there's some bad standards. There are some standards that are the answer to a question no one was asking. But there are also some very good standards that also lie fallow. And utilization data, as well as impact data, can help us understand why that is the case. So that's just first order for our association. And I think for any standards development organization is to help. We need data that steers the effort, because the effort is a lot of effort. And learning how to not waste that effort and to use it effectively and to be more efficient is something that we would definitely like to do with this data.
Great, thank you. Elise?
Yeah, if you're developing standards in the human health and environmental protection space and you have that data, come talk to me. Do that first. But in all seriousness, I think there are a lot of ways that this data can be used, but outreach is a really important one. I know this would be valuable to us, and I think it would be incredibly valuable to any organization that might have a lot of standards professionals who are retiring and a new crop coming up that might be more skeptical, that might be approaching standards not like, I've been in this organization for 20 years, I'm going to get involved in whatever committee, but that really do run cost benefit analysis of, is this worth my time? Is this going to advance our mission? Is this a good use of resources? And I think that's true of government agencies, it's true of companies. We're seeing that across the board. So I think this data is what helps answer those questions and helps get the new crop of standards professionals involved in using the standards.
Great, thank you, Elise. Doug, what would you like to say?
Yeah, I'd like to, I think you're right, David. I think we have to look at for example, the exercise we're doing is part of a continuum. Once we understand the impact, we need to be able to measure exactly how we're impacting people. But one of the things we're doing, for example, on our major safety codes, like our electrical code, our gas code, et cetera, is when proponents are advocating for change, we're asking them to describe why they're recommending a particular change and what they also believe the impact of that change is going to be. And if we absorb those changes into a code, I think it's incumbent upon us to measure the impact afterwards. Did it have its intended consequence? And if not, why not? So I think understanding where our standards are being used, what kind of impact they're having or not, is part of a feedback loop for continuous improvement in the standards we're developing.
Great. Tim, I'm going to let you have the last word on this one before we close here.
I would just say if that data is available, I mean, when we have it, we use it extensively because one, it shows the value, and two, it shows the integrity of what you're doing. So the best way, my opinion, to raise recognition of standards, sell standards, move standards, have them implement and use, is to show the value of them and be able to show the how they are being used as far as implementation in the workplace. If you can do that, my opinion is that's 9/10 of the battle.
Great. Great. Thank you. Thank you, Tim. Thank you to all of our panelists today. We had a very diverse panel from manufacturers and associations to folks who have worked in the consumer space as well as SDOs. And so this has been very valuable gathering those different perspectives on how we move forward from here. A couple things that I heard is that there is consensus that this is an extremely important topic that needs to continue to be addressed and advanced as we go forward from this point and this meeting. So there's agreement that we need to continue to move through this effort. The second thing I heard was that we need to be cognizant of how the impact case studies or metrics or whatever the result of a specific impact study is. We need to be careful about how we use that because we are in an environment of miscommunication and disinformation, as a matter of fact. So we need to make sure that we have the right kind of impact story or impact data for the right audience as we go forward from here. We talked about how broad this situation is with a lot of different kinds of standards, ranging from test methods to systems standards, as well as management standards. And we're looking across a wide variety of effects, whether it is injuries or whether it's chronic health outcomes. And those all complicate our overall landscape on how we go about doing this. So part of what we need to do is we need to scope this into one or a few efforts that will allow us to take some concrete steps forward. But the other thing that I heard from the panelists is this group has learned a lot, and we hope the audience as well has learned a lot through this conversation, and that we all remain committed to advancing this conversation after we leave the workshop today. So again, thank you to Elise, Doug, Chuck, Don, Casey, Tim, Randy, and Amanda. We certainly appreciate all of your participation and your contributions to this effort. And we're about ready to go into the break, but please, as Scott pointed out earlier, don't leave yet. We do have a specific question and answer session later, just following the next break. So with that, I'm going to turn it back over to Jim McCabe.
Thank you, David. We'll now take a break until 3:20 p.m. Eastern. The event's going to remain live during the break. If you log off, you can rejoin the meeting at 3:20 using the same access link you used at 11 a.m. Again, we will begin at 3:20 p.m. with the audience discussion. Thank you. As a reminder, before we begin the final Q&A session, this event is being recorded and will be posted publicly. For those who do not wish to be recorded, please keep your video off during this part of the program. We do encourage audience participation. We also encourage you to turn on your video. Please continue to submit your questions in the chat. If you're only connected to the meeting by phone, please dial *9 to raise your hand, and when you are called upon, dial *6 to unmute and to mute yourself. Our panel moderators from earlier today, Scott Ayers from CPSC and David Roth from UL, will facilitate this dialogue. Scott, David, over to you.
Thank you.
Thank you very much. So just to reiterate, our goal for today's meeting is really to begin this process of developing a methodology or methodologies for assessing the impact of standards on health and safety. We did try to answer as many questions as we could during the different parts of the program, but now we'll want to bring any additional questions that you might have as an audience forward, and we'll do the best we can to direct those to our panelists and presenters. A few of them have had to drop off the meeting for other commitments, but we'll certainly try to do our best to get those directed as possible. So for our panelists and presenters, you're not quite off the hook yet as we go forward. So the first question that we had that came in that we weren't able to address earlier, and this would be to one of our standards development organizations. And that is, are there any risks or downsides to the idea of measuring the impact of your standards? And if so, what do you think those risks or downsides might be? Doug or Casey, might you field that one?
I can take that one, David.
Thanks, Casey.
Yeah, so when we started our case study approach, that's something that we looked at. We understood that as we went out and pulled some of this data from CPSC, SaferProducts.gov, the NICE system, just because we pulled data on safety and in the injuries, amount of injuries, doesn't mean that it would necessarily be positive in our favor based on revisions to our documents. So that's something that we went out and we understood that going forward. And I think this we spoke on this a little bit earlier about taking that data back and improving your standards. But yeah, that's something that we definitely looked at and we were aware of, and we as a group we discussed that could be an option, that we may come up with things that necessarily could be a negative impact rather than a positive impact.
Great, thank you.
All right, should I ask the next question that came in?
Go ahead.
All right, lagging indicators are outcome measured and that are easily identified. How do you know an appropriate leading indicator when you see one? This is probably perhaps Tim or anybody else want to field this one?
I'll take a shot. This is Tim. First thing I would say is that, so we're writing a standard for leading indicators. But I would say within any organization, a lot of times the indicators you're going to use is going to be specific to the organization. So maybe it doesn't work. For example, if you're going to have something that deals with automotive and you're not going to use an automotive leading indicator if you're manufacturing buggy whips. So I would say one, the indicator has got to be applicable to your organization. Two, it's got to be implementable and it's got to be measurable. So it can't be something that's so high in the pie, so high in the sky, and that it is you can't measure it. So that's what I would tell you. One, is it applicable to the organization? Two, can it be measured? And three, will it have a positive impact? Those are the three things that I need for you to look at when I say you look at different indicators your organization uses. Otherwise, I mean, if you're talking lagging indicators, if you're talking safety, a lot of those are required by the government anyway. So, you have to have certain types of rates you got to report. You don't have a choice on that. So that would be my answer on that. I don't know if I answered the question correctly or around it, but that would be my thought on how to approach it.
Now, there are no incorrect answers, but I believe Elise just raised her hand. So I think she has something she'd like to add.
Sure. Not to sound like a broken record, but risk assessment and benefit cost analysis are great tools. And how do we know that those are good? They're based on a wide variety of science. They're published, they're public and transparent, and people can come in and tear them up if we got it wrong. Often they're peer reviewed. And I think that's, those are disciplines that are important to look at here when you're looking at leading indicators. So it's not just, hey, I think this, whatever is bad, but it's, we've used a disciplined approach that is public, that is transparent, that is peer reviewed. And, if there is an interest in going with a voluntary consensus standards route to measure the impact, I would note in our agency and maybe in others, voluntary consensus standards do meet our requirements for peer review. So, that would be immediately built in.
So I'll point out here in this conversation that I've always said, I'll know it when I see it. So I'm glad that other people could articulate a little bit better than when I would answer that. There's a follow-up to the question about the risks to the SDOs, or the SDO perspective on this. And we talked earlier about the state of disinformation, and in some cases respected organizations have lost credibility. So the question is, how can we address the credibility or a bias issue that might be in place? Because in what we've talked about is the SDO assessing the impact of their own standard. And so there, might appear to some people to be a conflict of interest there. Any of our SDO folks want to take that one on? I think Doug just raised his hand first.
Yeah, I mean, I think this is where the importance of using outside sources to validate what your standards, how your standards are impacting them, is very important. I mean, in addition to the project that we described this morning, we're also looking from a marketing perspective at an initiative coming up to look at how do our stakeholders, how our governments, how our industry, how our consumers, how do they view how do they view us as an organization? How do they view our standards? Are our standards of value to them? So in the model that we're going to be using, we're not evaluating ourselves. It will be those using our product that will be evaluating us.
Thanks. And Tim, I think you have a point of view.
Yeah, I would say, I personally think it's very important within the committee that you're using. So ASSP can't be telling the committee what to do, for example. It's a give and take, and it's a 50-50 proposition is the way we kind of handle it by us. So we don't dictate to them and tell them what they have to do. And I think what that does is it creates and maintains the integrity of the standards development process. So do I think you got to have an outside group look at it? I suppose there's some value to that. I wouldn't disagree with that. But to me, it's the value of the committee, how they're making their decisions, and can you defend the process that was used to create that standard. And so that's what's going to create that integrity, and that's what it's going to give it its credibility.
Thanks, Tim.
Okay, so I want to ask the question, and I know we talked a little bit about this in the last round, David, but what should we be looking at for specific next steps and then long-term goals? Somebody mentioned the possibility of maybe developing a voluntary standard based on this, but that might be something that's a little farther down the road than, a more immediate thing. What are we looking at, in your opinion? And I'm asking this specifically to David as opposed to the panelists.
Thanks for that, Scott. So, the first thing, again, to reiterate a little bit is, the team that put the workshop together for the last 6 months and culminating in today is going to take all the information that we heard from our presenters, from our panelists, and from the questions that we've gotten from the audience. And we're going to condense that down into a report and, some additional deliverables, maybe more bite-sized than a report, that will summarize, the activities that we've had today. I would suggest that the next thing that we need to do is to, the next thing we're going to do is we're going to survey the audience to see who might be willing to participate in follow-on activities. So at the close of the meeting today, there will be a survey link that is provided to you that you can express your interest in joining this coalition of the willing. And then we'll, take that information and begin to scope out, a set of preliminary meetings to talk about how do we move forward from here, and assess the idea of, is it one group? If we have, a small group, maybe it's one team that begins. But if we have an overwhelming response, maybe we set up some sub teams. Those are my thoughts right now. Scott, any additional from you?
I think what you're saying makes a lot of sense to me. I think it's been pointed out before that Randy said it, that the stuff that affects him is not necessarily the same stuff that affects Tim, but the problems are pretty similar. So I think it makes a lot of sense to kind of look at that and see how to divide it up within a group of interested parties. I think the other thing I would say is I think it's been reasonably successful so far today, and we could certainly talk with ANSI about revisiting this next year. Perhaps a little bit more depth as what's happened between now and a year from now. But if this is something that other people felt was worthwhile, maybe this is, we do a continuation at the World Standards Week next year. I think you're on mute.
Am I off mute now?
Yes.
I was saying maybe next year we can even do this in person at World Standards Week.
Well, that would be the hope, right? But how long have we been talking about in person? So.
Exactly.
Let's. I want to pivot a little bit. The panelists have been asking themselves questions. How about for David or myself? Do you guys have any questions for us? And I see Joe Batia has his hand up. So perhaps after you guys ask us any questions you may have, we can go to Joe and let Joe chime in there. Sorry, Joe, for not catching that hand up until after I had.
It's okay. I just raised it. It's been a long day for me to hold back. I usually don't stay quiet that long. But I honored the experts. I honored the information you were sharing, and I think you did a great job. Congratulations. So I actually intervened to just reinforce your thoughts about being able to work on this again next year. And I think it would be wonderful if we could have the same team with CPSC and also with UL supporting the effort together. It's worked out very well. Why not continue success? So that's all I wanted to say. I didn't have a question or a comment on the content.
At this point, I think I would be on board for participating next year. I think this has been a very worthwhile experience. I think a lot has come out of it, and I've enjoyed working with everyone.
All right, it looks like Doug's taking us up on your offer there, Scott.
All right, Doug.
Yeah, first of all, I see Joe there. Nice to see you, Joe. Glad you and the family are remaining healthy. I guess my question to you is, did this day achieve the objectives that you had established for your organization?
I think it was a great discussion. I don't think you have achieved your goals yet. You're on your way. So we will encourage you to continue. I enjoyed it off and on, quite frankly. It's too long a day for me to sit still. And I did take a few calls in between. There's always cheating going on in a session this long. I hope you forgive that, but you've done a great job, and team is very complex. There are a lot of difficulties, as you guys talked about, that we need to overcome. But the motivation is there that exists in all organizations, SDOs, certification bodies, SDOs, and independent engagement constituencies that are industry, that are users, and ourselves. As ANSI's role is along these lines, we're very happy to continue to work with you.
Thanks, Joe.
I can answer what my desired outcome was, which is really going to be the follow-up. Are we going to get people who want to continue this dialogue after today? If we indeed get that, then I think it's been a successful meeting.
I would add to that one of the goals for today was also to share best practices in various different disciplines. We heard from an economist. We talked about information that might come out of epidemiological studies and that kind of thing. Various approaches that are potentially applicable to the problem that we're trying to get to. And so a number of people have mentioned that it has expanded their view of what might be possible as well as what the problem is. And I think we did a good job of getting that kind of broader perspective on the problem out there, which is a necessary step to the solving of the problem, if you will.
Yeah, no doubt you made a lot of progress today on many fronts.
Tim has his hand up.
You know, I would say I'd be really interested to see if there's the ratings or surveys that come back on this. I always believe I'm the master of the obvious after it's pointed out to me. So my guess is we're going to get some really good ideas from participants saying, hey, you know, you did this good, and maybe you didn't do this so good. So I'll be really interested to see any feedback on it and then to help rate for the future. But you both put in a tremendous amount of time, and you seem to think it was worthwhile. And I think that speaks for itself. So I did want to note all the time you put in, and thank you very much.
I can never fully accept praise like that without pointing out that there are other people besides David and I. We were just the ones to volunteer to go on screen. I would like to also thank David's colleague at UL, Andrew Kapp, who is messaging us behind the scenes, as well as Jim McCabe, who has helped us plan all of the organization. Those two were every bit as important as me and David, and I would say they're probably more important than me.
I echo that. There was a village that put this together for sure. Elise, you have your hand up?
So we should give her a chance to talk.
Over to me?
Yep.
Okay, yeah. I have a question for all three organizers, ANSI, UL, and CPSC. I think today's discussion was excellent. And you guys are the dream team as far as leading this. What is it going to take to keep you guys in that leading position, to kind of move this initiative forward?
I'll let Andrew go first. I'll let David go first.
Well, yeah, we've been our leadership has been very clear with us that we want to understand the impact of our standards. And so there's no arm twisting going on here. Our team is up for the continued engagement in whatever path we go. Certainly would love to do this again as part of World Standards Week next year, as Joe has so graciously offered. So again, we're in.
I'll talk about myself individually. I'm certain that my organization loves this, loves my participation. But for me, to keep myself in, or to keep me interested, I just want, I want people to want to get something out of this.
Right.
I'm a consensus body worker. I get a lot out of going to meetings and talking with other people and trying to move concepts forward, whether it's because you're trying to develop a consensus safety standard or because we're trying to solve something else. So for me, I get a lot of enjoyment over getting to work with a variety of people. So hopefully there are people who want to work with us, and that's all I'm looking forward to. Looks like, David, we had another question come in. Building on Jancho's question, it makes sense for the standards, utilization, and impact data to drive the opportunity to improve our stakeholder audience and outreach in getting the right people at the table. Suggestions for setting the mindset and accomplishing this. So I think basically, how are we going to convince people to come talk, and how are we going to keep them engaged in the conversations? Anybody want to take a stab at this? I'll start. I think for me, the goal here is the message that you're telling your potential participants. You want to share with them what they're going to get out of that. And when we set up these presentations, we were very deliberate in trying to do that. And CSA was kind enough to talk about what they were working on, because it really gets down to the overall business case. If you're able to get some organization to understand the benefit in real dollars and cents that their participation is going to have, you're more likely to get their participation in the process. And this is not just from an SDO standpoint. I mean, the U.S. Consumer Product Safety Commission, we're not an SDO, but this all started because we wanted to try to gauge the overall benefit that we provide to the American people by our participation in standards. And when you look at other organizations, whether they be manufacturers or safety people or even consumers, the goal here is really going to be giving them the message that they can get some sort of benefit, and we can measure that benefit out of their participation. So that's how I think you get them there, and then you keep them there by having the necessary conversations that keep people going. That's really, in any sort of consensus group, it comes down to whether you have the proper leadership leading that group. You know, the chair of the group has to keep the conversations moving forward. So I think that if we can find the right people and we can find the right chair to spur the conversations, we'll put ourselves in position for the best possible success.
Yeah, Scott, I'd like to add on to that one in that, you know, one of the things that UL Standards recently did was to ask our volunteers, our technical committee members, you know, why did they participate in our standards process? And one of the most common responses was that they felt that they were doing a good thing for society, that mission of, you know, undertaking standards development for, you know, security, for sustainability, for safety is something that they personally got a lot of gratification from in doing that. And so the other thing I think to set the table here is to you know, bring people to the table is by being able to measure and report back to those people who are doing it because they know in their heart that it is leading to that better outcome for society, and then giving them, you know, the hook, if you will, with the hook as in a good way, that they are having that very specific outcome, that there is measurable benefit to that, will continue to keep those folks engaged. And then they'll pass that on to the next generation of folks that we want involved in our standards development activities. So being motivated by the mission, whatever that might be, but you know, here we're talking about health and safety, and then being able to back that feeling of accomplishing the mission with specific metrics will really help people get involved, stay involved, and bring their best to the table.
If I may add to your comment, with your permission, there are other elements that one can approach this solution from also. You know, many countries in the world, especially the developed economies, do analyze what the commercial value is of us engaging in standardization activities, standards and compliance, both included often. They're looking at just recently as an example, UK hosted the General Assembly meeting of the ISO annual meeting, and they developed a results-oriented report basically saying that participation in standardization activities has created a revenue growth of X.X, you know, euros. Well, it's not euros in Europe, I mean in London, but it's Europe. And other countries like Germany and France have done that also. So financial gain to the economy, uplifting of the commercial activities, benefits, if you will, to various constituencies, not just health and safety, but also other elements of quote unquote benefits could be looked at as potential areas for which targeting can be measured, for which measurements could be easier to get out, as perhaps we discovered some are easier, some are not today. And I think if we go through a process next year, one could also start by looking at what are some of the best practices that exist around this type of activity, and how do we better capture the data and the, I guess, financial numbers as well as other benefits of all types that are tabulated by many countries in many different ways, and pick and choose the ones that are applicable here, that we might be resonating with. Our community may be more interested in learning about those. So it's just a thought. I'm not an expert in this area, but just listening to you talk made me realize that there are a lot more benefits that accrue out of what we do as a society. We had even talked about going to the Congress, quite frankly, recently, last year that was, to find out if there was going to be any way for a credit to be given for investment in standards, because standards produce a lot of benefits for the society, for the country, for the economy, for commercial as well as other factors. It got distracted because of other things happening like COVID and of course a lot of investment in issues which require a lot of funding. So this wasn't likely to be a subject to discuss right now, but there's a lot of passion for that. There are a lot of industry members that think that would be a wonderful thing because they can continue to support and more robustly participate in the process that we all embrace.
Thanks, Joe. I see Doug Morton's got his hand up.
Yeah, just to add to what Joe just said, I mean, one of the things that we're doing here in Canada is looking at interprovincial trade barriers. And of course, standards is a tool that allows you to overcome those barriers. And so we, one of the values of standards is to help, again, alignment across policy issues. And we're seeing that whether it's in boilers and pressure vessels, whether it's in occupational health and safety, first aid kits, et cetera, et cetera. So to Joe's point, it not only will remove interprovincial trade barriers, but it's also going to allow free movement of people and expertise across the country. So to Joe's point, there's an economic side of this as well as safety and health.
All right, we are nearing the end of our allotted time. David, do you think we have enough time for one more quick question, if you have one?
I think the only other question that I might pose to the both to you, Scott, as well as the other folks who have participated today is, is there a short-term deliverable that you think we should be focused on beyond the kind of the report out from today? Is there, again, a voluntary consensus standard for measurement is a long way off, but is there something that maybe we could get to in 6 months, a year, that would be a good intermediate step along the way?
Well, I'll share really quickly my thoughts. I think the biggest challenge we have is data. And maybe the first step I could think of would be to put out some guidance document about sources of data, using data, mining of data. You're a data scientist, so you understand that. I am just a user of data, but I'll tell you, that's probably the first thing I think we could tackle. Now, can we get that done in 6 months to a year? I'm not sure, but I think that's probably the first step in any sort of work that we do collaboratively.
Thanks.
Casey has his hand up. You're muted, Casey.
Sorry about that. I totally agree, Scott. I think if we can identify additional sources, whether those sources are global sources, international sources, I think that's a huge step, at least for us, that would help our case study approach to get some credible data, and then also identify, what kind of data do we want to receive, and tapping those additional sources and getting those individuals on board too. So I think that's a very positive step, and I would agree in that direction.
Okay, any other thoughts? We have about half a minute here before we need to move on. All right, I think, David, that's probably it for this portion of the meeting. I do want to point out that there are 3 people we did not mention before who are absolutely positively the most important people in running this meeting, because without them, this meeting would never have happened. It would not be on Zoom, and it would not be run as well as organized as well as it has been today. I take no credit for any of this organization. This all goes to the tech team, Jana Zabinski, Stacy Lesner, and Stephanie Carroll. Without those three, this would not be happening today. It would still just be a pipe dream in our minds.
Yeah, so the other thing we'd like to point out, as I mentioned a little bit earlier before, and that is we will be setting up through the information that you've already given us, we'll be emailing out a link to the post-event survey, which you also see on the screen right now. We'll be posting it in the chat as well. And the idea, again, being that we would love to see who is interested in joining us in those next steps to move this effort forward. And the other thing to point out is that we know that this was somewhat of a limited format in the way we could engage with the broader group of standards professionals and stakeholders who are out there. So we do encourage you to get in touch with Scott, myself, Andrew, and Jim McCabe from ANSI to have any follow-up conversations that you might want to have beyond what we were able to do in the work today as we go forward. So with that, Scott, any additional closing comments from you?
Just thank you all for sticking with us. I know it's been several long hours, and we appreciate that. Even those who weren't able to attend for the entire time, we're just glad everyone was interested and wanted to hear what we were talking about today. So thank you all. Thank you to those who helped us, the presenters, the panelists during the second part. You guys, it was just completely invaluable